Very good morning to one and all. I welcome you all in day 2 of Rehab-e-con 2021. Today we have scientific paper presentations, and this is hall for CBR paper presentations. So to begin with, I would like to welcome both of our judges, Dr. Chandu Basavaraj and Dr. Hande ma'am, Pipali Hande ma'am. I would like to introduce both the judges here. So to begin with, Dr. Neha Deshpande will introduce Dr. Pipali Hande ma'am. Everyone.
We have with us Dr. Dipali Hande ma'am. Ma'am is a professor and HOD Community Physiotherapy Department at Dr. APJ Abdul Kalam College of Physiotherapy, Pravara Institute of Medical Sciences. Ma'am is a coordinator of Indian Association of Physiotherapy Women's Cell at Ahmednagar district. Ma'am is coordinator of Srimati Sindhutai E. Vikhe Patil Spinal Cord Injury Rehabilitation Center. Ma'am is having total experience of 13.7 years. Ma'am has received many awards as well. Ma'am has received a significant contribution award at National Indian Association of Physiotherapists Conference. Ma'am is a mentor for national program goal that is going online as leader program of Ministry of Tribal Affairs. Ma'am is a member of Board of Studies at Academic Council at program. And ma'am has been nominated as India's top 100 doctors in physiotherapy by Global Outreach Medical and Health Association. And ma'am has numerous publications in her credit. Ma'am has been a guest speaker in various national and international conferences. So, ma'am, we welcome you. And Dr. Richita will introduce.
A very good morning and warm. I'd like to introduce our second judge for today, Dr. Chandu Basavaraj sir. He has a rich experience in physiotherapy academics for about 20 plus years. Currently working as principal and professor at GESTM COPT, Nashik. He has been a resource person for various CMEs, workshops, and conferences, and he has also worked as organizing secretary for various conferences throughout his career. Sir, in his rich experience, sir has guided around 40 postgraduate students and 25 undergraduate students in physiotherapy so far. He is a postgraduate examiner at various prestigious universities, including MUHS, Manipal University, DP University, Gujarat University, to name a few. Community physiotherapy, community-based rehabilitation, women's health, industrial health are his special areas of interest. And we are delighted to have him as our judge today for scientific paper presentations. I request Dr. Dipali ma'am and Dr. Chandu sir to kindly turn on their videos. Presentation and day 2 of Rehab-e-con 2021. Shall we start with the presentations?
Yes.
Yes.
Okay. To begin with, we are starting with senior category. chat box. Are we audible now?
Yes, you are.
Okay, better. Yeah. To begin with, we have our first presentation in senior category CBR. CBR 01, are you ready? You can unmute yourself.
Hello, am I audible, ma'am?
Yes. One minute. Your time. Is the PPT visible to everyone? The time starts now, and you will be given a reminder at 5 minutes.
Ma'am, how do I change the slides?
I will change that on behalf of you. You just let me know that I have to change. Say next, I'll do it.
Okay, okay. Thank you, ma'am.
Okay,
Okay.
your time starts now.
Okay. A very good morning to all of you. The topic for my presentation today is comparison between postural sway velocity and balance in geriatric diabetics without diabetic peripheral neuropathy and non-diabetic population. Next. Next slide. Introduction. Diabetes mellitus is defined as a disturbance of intermediary metabolism manifesting as a chronic sustained hyperglycemia, primarily due to either an or absolute or a relative lack of insulin. This may be accompanied by other biomechanical disturbances and presence of progressive diabetic tissue damage with microvascular complications. Prevalence of diabetes in India is around 8.8% according to International Diabetic Federation. Adequate postural control requires keeping the center of gravity over the base of support during both static and dynamic situations. Out of many complications of diabetes, posture instability reflects an impairment of somatosensory system. Next slide. Need of my study. Altered gait and postures were found in diabetic patients irrespective of polyneuropathy. Reduction of vision with reduced proprioceptive inputs increased the odds ratio of a fall during testing by 5.7 folds. Usually, patients start complaining balance issues and fear of fall after the development of diabetic peripheral neuropathy, which may have been prevented if early interventions were started. There are many studies on postural control and balance impairments in diabetic patients with peripheral neuropathy, but there is no sufficient research on postural sway velocity and balance in diabetics without peripheral neuropathy. Hence, analyzing and comparing the effect of alteration in sensory inputs on postural control in elderly diabetics and non-diabetics may help us to understand in which situation these individuals can perform worse. Early detection of risk of development of peripheral neuropathy can prevent or at least help delay its development. These results can facilitate an appropriate treatment program for improving stability and preventing functional impairments for this population. Next slide. Next slide.
1 minute.
Next slide.
Yeah. Don't worry, your time will not be.
Yeah. Hypothesis, there is a significant difference between postural sway velocity and functional balance between elderly diabetics and non-diabetic population. There is no significant difference in postural sway velocity and functional balance between elderly diabetic and non-diabetic population. Next slide. Aim of my study was to compare the postural sway velocity and balance in geriatric diabetics without diabetic peripheral neuropathy and non-diabetic population. Objectives was to assess and compare postural sway in geriatric diabetics and non-diabetic population using modified clinical sensory test for sensory integration and balance, that is MCT-SIB, and to assess and compare balance in geriatric diabetics and non-diabetic population using timed tandem walk test. Materials and methodology. Study design is a comparative study. Sampling technique for purposive sampling. Sample size was 100. Materials used was balance master, foam block, stopwatch, measuring tape, Michigan neuropathy screening instrument, paper, pen. Inclusion criteria: age 60 years and above, diagnosed diabetes mellitus. Exclusion criteria: diabetic peripheral neuropathy confirmed by MSSI, that is Michigan neuropathy screening instrument, vertigo, vestibular dysfunction, any neurological orthopedic concerning lower limbs condition, visual impairments, and cognitive impairment patients. Outcome measures: time tandem walk test. The subjects were instructed to walk on a straight line, heel to toe pattern, without spaces between the steps. The distance covered was 3 meters. Timing with a stopwatch began when the subject was instructed with a go, and ended with the patient reaching the endpoint. The time required to complete the test was recorded. Next. Modified clinical test for sensory integration and balance. Subjects were tested on balance master in modified CT SIB mode for following under 4 different sensory test conditions. 3 trials of 10 seconds each: eyes open, firm surface, eyes closed, firm surface, eyes open, foam surface, eyes closed, foam surface. The subjects were asked to stand on a force plate with feet with shoulder width apart. Time and balance, increased sway or loss of balance was recorded. Next. Permission from the head of institution, approval from the ethical committee was done. 138 geriatrics was screened with Michigan neuropathy screening instrument. Inclusion and exclusion criteria based on that, 100 subjects were chosen. Consent form was taken from each subject. 50 diabetics and 50 non-diabetics were selected by using purpose of sampling. And my outcome measures were Neurocom Balance Master, which allowed me to do modified clinical test for sensory integration and balance under 4 different sensory condition, and timed tandem walk test for distance of 3 meters. Next. These 100 subjects selected were divided into
Sorry, ma'am, 5 minutes done.
yes. Next slide. Next slide. Yes, the statistics were run using a Interstat software. Next slide. Next slide. Yes. As we can see is the following table shows respective test conditions in which group A is a diabetic group and group B is non-diabetic. We can see that in a firm surface with eyes closed, we can see that there's a significant difference between the postural sway velocity, but there was no significant difference in the composite scores. Whereas in time tandem walk test also, there was a very not statistical significant difference, but there was a clinical significant difference. Next slide. Yes. Next slide. Yes. Now the results of this show that there's no significant difference in time walk duration during both groups, but there is a significant difference in postural sway velocity on firm surface with eyes open as well as eyes closed. Next slide. Yes, a systematic review done by Amira Mistupa in Malaysia compared 38 studies in which they showed that postural instability, gait imbalance, and diabetic peripheral neuropathy may contribute to high risk of fall incidence. But usually the studies which were done earlier, they were done with only two sensory test conditions, that was with eyes closed and eyes open, while using a force plate
Excuse me, ma'am, 1
force
minute left.
platform. Yes, yes. Next slide. Next slide. Yes, yes. From the above study, it can be concluded geriatric diabetes have decreased postural stability. Therefore, non-diabetic patients also may even develop have the risk of development of diabetic peripheral neuropathy. Thus, these evaluations can facilitate appropriate treatment program. And usually, in normal routine evaluation processes, we are not doing any evaluation for postural stability. In fact, we are just doing evaluation for static balance. And if the patient has complaints, otherwise, normally for an elderly evaluation process, we are not using these available instruments for us as a routine part of our evaluation process. Next slide. Next slide. Yes. As diabetic patients have increased risk of fall due to increased postural sway, velocity, firm surface. Balance training should be as effective, and it may delay the development of diabetic peripheral neuropathy. This might improve the functional capacity of patient and help him stay independent as long as possible. So as a routine part of process, if we use this
Time up.
available, yes.
2 minutes
Thank
for
you.
question answers. Participant is not supposed to turn on video.
Yes, ma'am.
Yes, I have a question.
Yes, sir.
Am I audible?
Yes, sir. Yes, sir.
Yeah. So what take-home message or recommendation would you like to give based on your research outcome? Whatever. Please.
Yes, sir. So as a part of routine diabetic evaluation process in geriatrics, usually they are more concerned with foot ulcers and more concerned with foot treatment process. But what we would like to suggest here is from our research is that whenever diabetic patients are coming to us as a form of routine checkup, we have to do their balance assessment using different surfaces so as to check whether they have any involvement of somatosensory system or any involvement of proprioceptive loss, and that can only be done if you have a force plate and
Yes.
you're using
Yes.
balance master.
Yeah, your main concern is you want to incorporate the postural assessment, right? Balance.
Yes, sir. Postural
How would
instability.
yes, but there are certain restrictions at the community level. When it comes to community level, yes, at the institutional based level, yes, this may be a possibility.
Yes,
But
sir.
how it can be made a possibility at the community level when it comes to suburban or rural areas?
So in those cases, sir, first we can use this Michigan neuropathy testing screening tool. So in which it incorporates various systems like somatosensory system, and it incorporates even proprioceptive loss, and even it incorporates a vibration perception at the foot level, which tells us about the starting signs of development of peripheral neuropathy. So if those patients can be screened early, then we can start a balance training program. And if it is available for us that we can get this people to the setups where at rural center it is available for us to use balance master, then we can do the system, because usually we do postural strategies to evaluate whether the ankle strategy is lost, whether hip strategy is lost, but we are not using screening tools. We as therapists should use these screening tools so that we can avail these facilities to the
Okay.
community.
Yes. Thank you.
Thank you, sir.
I want to congratulate the presenter. It's a very good study. My question is that how
Thank
you
you,
have
sir.
excluded patients who are having vertigo?
Ma'am, we have not included patients who have any signs of dizziness or who has any signs of instability with the who already have these, who have been we have taken patients who are diagnosed diabetics, and we have not included patients who had dizziness, who had complaints of loss of balance at a very narrow base of support. So we have used that Michigan screening test, which exclude this. There are these questions available in that Michigan screening tool, wherein we have excluded patients who have these complaints.
Okay, good.
Okay.
Hello, am I audible?
Yes, yes. Can we move ahead to the next presenter?
Yes.
Okay. So the next presenter, be ready.
Thank you, ma'am. Thank you, ma'am.
Yes, thank you. Next presenter is CBR Senior 02. Just 1 minute. We'll have to take the next presentation first. CBR SR03, please be ready. CBR SR03, please be ready.
Hello.
Yes. CBR SR03, are you
Hello.
ready?
Yes,
Hello?
ma'am, I'm ready. Am I audible?
Yes, you are audible.
Yes.
Your time starts now.
Okay. A very good morning to everyone. The topic of my study is efficacy of supervised static and dynamic balance training in obese school children, a randomized experimental trial. My presenter code is Rehab-e-con senior category CR03. Obesity is a developing issue in public area where predominance has expanded persistently in many countries since 1990s. Among children and adolescents, 23.8% of boys and 22.6% of girls age group 2 to 19 years are generally classed as stouts in country. Obesity may be defined as abnormal growth of adipose tissue due to enlargement of fat cell size or cell number or combination of both. Obesity is expressed in terms of body mass index or BMI. BMI is nothing. Please change the slide. It is a measure of body weight adjusted for height. It is a useful tool to evaluate body fat. So the classification of BMI was done as follows, which has a chart for 2 to 19 years, in which the weight was divided by percentile and weight status. Below 5th percentile, it was underweight. From 5th to 85th, it was normal. 85th to 95th, it was overweight. And 95th above, it was obese. Corbett et al. In his postural control model indicated that obesity is also associated with high risk of falls and balance abnormalities. Balance, it is nothing, but it is ability of body to maintain the center of gravity within its base of support. And it helps us in preventing falls from day-to-day activities. Balance is divided into two types. It is first is static balance and then second is dynamic balance. Static balance is nothing but ability to maintain an upright posture and keep line of gravity within base of support, whereas dynamic balance is nothing but ability of maintain stability during weight shifting. Despite there are many factors that contribute to development of obesity in children, such as hormonal abnormality, unhealthy food habits, and sedentary lifestyle, its impact of quality of life of children is causing high concern for health professional because obesity is becoming a very high targeted area. Whereas there have been measures taken to reduce balance issues and to reduce frequency of fall, and it has become it has a good impact on improving overall quality of life, and so this has become the need for study of my topic. Next. Change. Methodology was experimental trial. Study population was 43 obese school children. Study duration was 3 weeks. Source of data was extracted from 2 high school cities in district city. Sample design was non-probability convenient sampling. Inclusion was 12 to 15 years age group of both the genders, males and females. Obese subjects with balance affected. Subject with informed consent. Exclusion criteria was recent injury, surgery, any neurological deficit or congenital deformity. Change. Please change. Study tools were data collection sheet, informed consent form, stadiometer to measure height, weighing machine to measure weight, stopwatch to take a control on outcome measures, and Bosu ball for balance training. Change. Can you change? The outcome measures was talk, balance, stand test, and 4 square step test, SBST and FSST. Next. The data was divided into 45 obese students of both the genders and 12 to 15 years were randomly selected, out of which 13 students were not willing to participate. So there were 30 students which were divided into 2 groups. 15 student in experimental group and 15 into control. Baseline parameters were assessed. The experimental group was given with supervised static and dynamic exercise for 3 weeks, whereas control was given no exercise program. Next.
Change.
Hello. The supervised balance training protocol was divided into 2 parts: static balance and dynamic balance. Static balance 1.5 weeks ke liye, it included double leg stance, double leg squat, bilateral single leg stance, bilateral single leg squat. These all started from 10 repetition for 2 sets, gradually progressing to 15 to 20 repetition for 3 sets. Then it was dynamic balance again for 1.5 weeks. It included double leg stance with Bosu ball, double leg squat with Bosu ball, bilateral single leg squat stance with Bosu ball, and bilateral single leg squat with Bosu ball. These exercises started from 5 repetition, 2 sets, gradually progressing to 10 repetition for 3 to 4 sets. Results of the study were analyzed in terms of improving balance by 3 weeks of static and balance. Please change. Balance training in obese children, which was measured by SBST and FSST, that is stock balance step test and 4 square step test. Intra-group differences were compared to evaluate efficacy of both static and dynamic exercise training. Statistical analysis was present. Study was done manually as well as by using GraphPad. Nominal data for students, demographic data, baseline, age, gender, BMI were analyzed. Comparison of pre-training and post-training outcome measures were analyzed. Probability values less than 0.05 were considered statistically significant, whereas probability values less than 0.001 were considered as extremely significant. Please change. This is the statistical representation. Table 1 gives you the
Excuse me, ma'am,
comparison.
5 minutes are done.
Comparison between group A and B. Table 2 gives you a gender comparison between A and B. Next, table 3 gives you a comparison of BMI. Please change the slide. Whereas
It is
the
graph
next-
5.
excuse me, whereas please इसके पहले वाला slide कीजिए आप.
The graph 3,
Yes.
3 and 4.
Yes. There is table 4 describes you comparison of mean difference of the static balance test. It was found that when compared for pre and post in group A, the p-value was found as less than 0.001, which was extremely significant. Whereas when compared mean differences of next slide, mean differences of the dynamic balance in pre and post in group A and B, it was also found that in group A, please change the slide. In group A, pre versus post, it was found p-value was 0.0014, which was also significant, which meant that when a dynamic and static balance training protocol was given, the group A, which was the experimental group, it was found significant results when compared for pre to post. Please change. Discussion. Change the slide.
We have changed it.
Yes,
Don't worry, your timing will be
evidence,
considered.
a current study aimed at the efficacy of supervised static and dynamic balance training in obese school children, which was found inconvenience with the another study which was done by Pallavi Sharma et al., who studied 87 obese children on assessment of static and dynamic balance in overweight obese children with and without flat foot. She found that the study that statistic balance was significantly affected in obese children with or without flat foot, whereas dynamic balance was affected only in obese children with flat foot. Another study of Abhishek Saridharan, who studied whether there is any relationship between obesity and balance among school children, found that a high BMI is correlated with balance impairment in school children. Next. Change the slide. In conclusion, this experimental trial has 30 obese school children. They were divided into 2 groups, each with 15 obese school children. They underwent for 3 weeks a supervised static and dynamic balance exercise program. At the end of training, static exercises and dynamic exercise had a statistically significant effect on balance, which was measured by the 2 outcome measure, SBST and 4 square step test, which was for the static and dynamic balance. These tests were done at the starting of the training program and at the end of the training. Hence, it can be concluded that the 3 weeks of static dynamic balance exercises are satisfactory improving balance in obese school children. Next.
Yeah, changed it.
Limitation was there was a small sample size. Age limit was structured, which was only 12 to 15 years. Further limitation is that the study can be undertaken. Study was undertaken only in a specific cross-sectional region. Next.
Ma'am, time up.
Future scope will be study can be done on basis of functional assessment using quality of life assessment for participant, or other analysis can be done on based on different categories of the schools. Next.
Please stop talking.
Next.
Time up. Time up.
Yes. So, a good presentation overall.
Thank you so much, sir.
I have a question.
Yes, sir.
So, how would you like, or what would be your inputs for effective implementation of your strategy into the community at the school level?
Yes, sir. So first of all, I think there should be effective screening to rule out the obese population in India, in our state, in our schools. Then we can implement, sir, balance training programs for students who are obese, because obesity is a high targeted zone nowadays in new era. So we can implement balance training exercise schedules, which can be forwarded to school, or a physiotherapist on a personal level can take these exercise schedule to improve balance and to maintain the base of support and center of gravity, which will be very helpful for them to not to be just in a sedentary zone, and they can have an active life as other students have.
Okay.
No question from my side. No question from my side. We can go for next presentation.
Okay, so next presentation is CBR
Thank you,
SR
ma'am.
02. Please be ready. CBR SR 02. Your time starts now.
CBR SR02, are you there?
Hello, am I audible?
Yes, yes.
Yes.
Your time starts now.
My research study is the effect of early pelvic floor muscle exercises, Kegel's exercise, after robotic prostatectomy in prostate cancer patients. Next. Next. It's not gone to the next slide. Hello. Hello. Hello.
Yes, Babu. Hello.
Hello. Hello.
Am I audible now?
Yes, you are.
Am I audible now? CBR 02.
Yes.
Hello. Am I audible now? CBR SR 02.
Yes.
Yes,
Are you
yes.
Yes, yes,
Yes. Yes. Am I audible?
yes.
okay, I'm sharing the screen for you then. Please unmute yourself, CBR SR 02.
Yeah, I've unmuted already.
Okay, I'm sharing the screen for you. Sorry, we'll be starting with the same again. There's a lot of background sound. Please mute yourselves, everybody. You can start. Sorry for the delay.
The presentation is very blur. No, I cannot read anything on the screen.
Just give us 2 minutes, please. There's some technical error. We need to take a. We'll just work out on it. Just give us 2 minutes. Am I audible now?
Yes, you are.
Yes. Please check the PPT again. I'm sharing the screen. Is it clear?
No,
Not yet?
no.
No, no.
Just 1 minute. Extremely sorry for the delay. Hello, please check whether you're able to see the PPT. Just 1 minute. Is it visible now?
No,
Still not?
it's manageable. I mean, it's very blur, but it's manageable.
Just 1 minute. Okay, we'll check again. We are just testing whether it is working or not. How is it now? Still blur?
Yeah, it is better now.
Okay, we'll start again. We'll start over again. Your time starts now, presenter.
So the topic for my study is effect of early pelvic floor muscle exercises, Kegel's exercises after robotic prostatectomy in prostate cancer patients. Next. So for the introduction, post-prostatectomy urinary incontinence, PPUI, due to open or robotic surgery has a negative impact on patients' psychosocial well-being and leads to an altered quality of life. The incidence of this ranges from 1 to 87%. Sphincteric incompetence overall remains the primary cause of incontinence. Pelvic floor muscle rehabilitation appears to be beneficial in hastening the return of continence. Therefore, there is a need to re-educate and strengthen the pelvic floor muscles as to see the duration at which the patient gains urinary continence, which could be achieved by Kegel's exercises. We herein report the result of Kegel's exercise in 69 patients post-robotic prostatectomy done at a cancer hospital in Mumbai. Next. The aim and objective of the study was to study the return of continence after Kegel's exercise on post-robotic prostatectomy patients. Report there is to report the time duration required for the pelvic floor muscles to regain strength and endurance, thereby leading to urinary continence and improved quality of life. Next. Out of 300 robotic assisted radical prostatectomy surgeries done at the center between July 2015 and December 2018, 69 patients who were fitting into the criteria were selected, and prospectively the data was analyzed. All the patients were counseled for temporary PPUI and its treatment. These patients were assessed on post-operative catheter removal day at 3 weeks, 6 weeks, and 3 months. Next. The protocol which we followed was pre-operative counseling, where the patients were counseled about the incontinence which they may face in the post-operative phase and the compliance which they require for performing Kegel's exercise for a better recovery. In the post-operative phase, on POD day 1, we mobilized the patients with the catheter. On POD day 3, Kegel's exercises were taught. The 3 exercises we taught was, first was with Kegel's tummy tuck, second was pelvic bridge, third was squeezing the ball between or a pillow between the thighs, and fourth was the rotations. On POD 10, the Kegel's exercise was reviewed and an increase in hold time and the assessment was done with the outcome measures. On POD 21, assessment with the outcome measures and the progression, if required, was taught. POD 10 was achieved. On POD 10, generally a patient went for a catheter removal. Next. The outcome measures used were the pelvic floor muscle grading, the 24-hour pad test, and the international prostrate symptom scoring, which has been used to assess the decrease in incontinence at 3 weeks and 6 weeks post-operatively. As we all know, pelvic floor muscle grading system scores from 0 to 4. So 0 is no contraction and 4 is 0 to 5, and that 5 is a strong contraction, and this was done in a semi-Fowler's position. Again, the second one was a 24-hour pad test, in which we asked the patient when they were coming to the OPD for a follow-up to wear a pad for 24 hours, and this pad was weighed and the weight was taken in grams. Next. Now the IPSS scoring system has 7 points, 1 question and 1 quality of life. So the scoring system ranges from 0 to 5, to 35 being the maximum score. So the questions under this questionnaire were incomplete emptying, frequency, intermittency, urgency, weak stream straining, and nocturia. This was given by the WHO and the International Union Cancer. So it recommends a single question for the quality of life, and that is graded as 0 to 6. 0 is not good quality of life and 6 is terrible. Next. Results and analysis in a total of 69 patients which were screened during this duration, that is 2015 to 18. It was observed that 4 patients had incontinence 3 months after the surgery. On the contrary, 65 patients gained complete continence. Next. In graph 1, we see that this is the pelvic floor muscle grading, wherein at the catheter removal day, they had weak contractions, and when it was progressed at the 6th week, it was seen that the patients had good contractions. Next. Next is the 24-hour pad test. That was the 24-hour pad test, in which at the catheter removal day, the patient had 72 grams of urine, residual urine in the pad.
5 minutes done.
Whereas on the 6th week, it was 12 grams. Next. Next. Now talking about the IPSS score, it was seen that the discomfort which was there, that was severe discomfort, and at 6 weeks it was mild discomfort which was seen as the scoring, depending upon the scoring. Next. Discussion, it is observed that there is a definite degree, that is 92.20% patient who gained continence, and only 5.79 had incontinence. The probable reason was due to damage and the sphincter and the disruption of the detrusor muscles. The study was discussed under 3 headings. Next. Next. The pelvic floor muscle, the previous slide. The pelvic floor muscle strength, it was noted that there was an improvement from grade 2 to grade 4. This was likely because the effective improvement in pelvic floor muscle strength is on the account of the regularity of the patient to perform exercises and to prevent the muscles from fatigue and disuse atrophy. Next. The 24-hour pad test, again, we've seen the reduction from 72 grams to 12 grams. And the probable cause of the weight of the reduction was due to the sphincter control due to increased strength of the pelvic floor muscles. Next. The improvement in the symptoms and the quality of life, this change from severe to mild discomfort was due to improvement in the symptoms and less, which also in turn leaded to less visits to the washroom at night. Also, there is an
1 minute,
improvement in
last
the
1 minute.
quality of life, which proves to have a positive feedback and reduce the psychosocial burden. Next. So conclusion, the study states that there's an effect of pelvic floor exercises on patients with post-robotic prostatectomy. The previous slide, the patient gains good pelvic floor muscle strength, shows a reduction in dribbling and leakage. And also it is seen that 94.2% patients have shown a full recovery. And if the patients perform the exercises regularly, then there is a good improvement in continence, which is seen. So from incontinence to continence within 3 months is what we had achieved. Thank you.
Question answers.
Well, good implemented study.
Thank you, sir.
No questions from my side. Thank you.
It's a very good and innovative study. My question is that what are the difficulty that you have faced while implementing Kegels exercises, specifically in male patients?
So, ma'am, the first difficulty which I had that because of since a male female therapist, that was an issue. So always the patients had to come with a female relative. I was very stringent with that. That if there's no female relative associate who's coming along with the relative, so that was one issue. And then again, some patients were apprehensive in exposing because since I was a female therapist. So these were the two major drawbacks which I faced during implementation of the exercises. But as far as the exercise protocols and the follow-ups were concerned, they were upfront and they were willing to have the follow-ups, the consecutive. So only that there was a barrier because of the male-female thing.
Because we have to consider the ethical issues, specifically when we are treating, other genders, specifically with these kind of cases. And do you think that you will get some different results if you compare robotic prostatectomy and manual prostatectomy?
Yes, ma'am, definitely, because the healing process of an open surgery versus a robotic prostatectomy, again, it's going to vary because of the incision. Now, here in the robotic, they had it was minimal invasive. So again, the protocols will be a little altered. That is, we can start Kegels maybe after a week if it is a open robotic one, where here we had started on post-operative day 3. So yes, there is definitely going to be an alteration in the protocols in open as compared to a robotic prostatectomy.
Okay, thank you.
Thank you, ma'am.
Next participant, CBRSR04, be ready. Sharing your screen.
Good morning, ma'am. Good morning, sir. Am I audible?
Yes, yes.
Okay. Can I start with it? The time has started.
Yes.
Yeah. Good morning, all. So my topic.
Can you be a bit louder?
Yeah, please be louder.
Yeah. Am I clearly audible now?
Not very clear.
Just a second. Am I audible now clearly?
Your voice is very low. Can you be a little bit louder?
Yeah. Am I audible now clearly, ma'am?
Or if you can just hold the mic closer.
Maybe I'll just remove the headphones. Just a second.
Yeah, please.
Okay. Am I audible, ma'am, now?
Yes, it's better than earlier.
Okay, sir. Yeah.
Your time starts now.
Yeah, thank you. Good morning, sir. Good morning, ma'am. So I had done to find the influence of BMI on muscular endurance and quality of life in overweight and obese postmenopausal women. So it was a correlation study. Next. So obesity, as we know, it is much commonly seen all over the world. So it's like a global problem, which is mainly characterized by the abnormal growth of the adipose tissue. And in women, it is seen that the muscle strength, the loss of muscle strength and muscle mass, it is much at a higher level and at an earlier age compared to men, and it usually occurs at the time of the menopause. Next. Menopause is associated with a natural decline in estrogen, all right. So, but because of that, there are a lot of ill effects due to decrease in estrogen. There is loss of bone mineral density, which is happening. Again, there is a risk of increased cardiovascular disease, and there is a redistribution of the subcutaneous fat mass to the visceral fat mass. And because of that, in the postmenopausal females, the obesity is more prevalently seen. So, maintaining a good physical functioning with age is extremely important in these females to improve the quality of life. Next. My objectives were to find the influence of BMI or upper extremity endurance using the push-up test, to find the influence of BMI on the abdominal endurance using the curl-up test, and to find the effect of BMI on quality of life in post-menopausal females using the MENQOL, that is the Menopause Specific Quality of Life Questionnaire. Okay, so I had included 50 subjects in my study. It was an analytical study with purposive sampling, which was implemented. Materials used for my study were weighing machine, mat, pen, pencil, paper, and a tape. Outcome measures for the study were the BMI, the push-up test, the curl-up test, and the MENQOL questionnaire. Next. Okay, so I had included the postmenopausal females who had BMI more than 25, and age group included was 45 to 60 years of age. Samples excluded were people with recent fractures, with uncontrolled hypertension, candidates who had undergone spinal surgeries recently, if any hospitalization was done in the past 6 months, if they were suffering from any psychological disorder or having any cardiovascular disease history, patients with symptomatic osteoarthritis, patients with any respiratory problems like asthma or COPD, they were excluded from the study. Study was started after the ethical approval, and the subjects were explained about the method. A written consent was taken from all the subjects for voluntary participation into the study. So pre-screening was done, in which we had seen which females who had attained the menopause. We had included them in the study, who were in the overweight and obese category. Those females were included. Demonstration of each of the tests was given to the subjects before the testing was done. The push-up and the curl-up test were assessed, and the questionnaire was administered, that is the MENQOL questionnaire. So this was the procedure. The push-up test was done for the females, the modified push-up test, and the curl-up test was done for the females. Next. So as we can see in the results that there is moderate negative correlation between the BMI and the push-up test, since our R value was minus 0.7. So there existed a moderate negative correlation. Next. And there was a mild negative correlation between the BMI and the curl-up test. So as we can see that the BMI was affecting the abdominal endurance mildly, because the correlation coefficient came to minus 0.3. Next. As we can see in the results for the MENQOL questionnaire, we have 4 domains there. That is the vasomotor, we have the psychosocial domain, the physical, and the sexual. So in the vasomotor domain, we have seen for the comparison between the obese and the overweight. So we can see that in the obese females, the mild symptoms were more than in the overweight category, and moderate symptoms were not that much. The mild symptoms were severely affected than the moderate. So yes, the next slide. The physical
5 minutes done.
Okay. Again, in the psychosocial symptoms, we can
5 minutes are done.
Yes, ma'am. Thank you. And in the psychosocial symptoms, as we can see, The obese category, again, the mild symptoms were more than the overweight as compared to the moderate category. Next. The sexual symptoms, again, as we can see, that they were affected most in the overweight than the obese females, but again, the moderate symptoms were not that much affected. Yes, next. So from this, I would like to tell that as we can see in the obese female, there is excessive fat mass, and this concentration of this fat mass is going to cause changes in the strength and endurance of the skeletal muscles. And individuals who are obese, they have an increased intramuscular as well as intermuscular fat mass, and because of that, what happens is there is a negative influence on force generation. So the force generation capacity is going to reduce, and that is further going to affect the functional independence of these females. Next. So menopausal symptoms are associated with fluctuations in the estrogen levels. So main are our estrogen levels. So if there are any imbalances in the estrogen levels, the menopausal symptoms might vary, and they can lead to increase in the weight gain. They can cause both physical and psychiatric problems. So that is the mainstay of the study. From this, I would like to conclude that there is negative correlation between BMI and endurance in postmenopausal females, though we have found out that there is a moderate to mild negative correlation, but yes, this correlation still exists. So if the BMI is good, then the endurance of the females is going to be good. This study also shows that the BMI mildly affects the quality of life. It is shown that the affection is mild, but there is affection of quality of life in these females if the BMI is more on the higher sides in the postmenopausal females.
Okay, ma'am. Time up.
Thank you.
Question answers for 2 minutes.
No question from my side.
Yes, I do have a question.
Yes.
What is the occupational background of all these females?
So actually, we have had the varied females, but most probably most of them were the housewives of this category. The working population females were not that much. We had not taken that into the inclusion criteria. But what we had found that most of them were the housemakers. So they were not in a working job.
Okay. Because the occupational requirements on the muscle system, overall muscular system, and
Yes.
the household pattern of working, where
Yes.
do their daily performances of the activities. So that also might have had the impact. So I would just wanted to see if the variations were like because of that factor.
Yes, sir. So most of them were housemakers. So you are right. Maybe because of the occupational requirements or the occupational demands, their endurance would also have been affected with that. That is there, sir. So that can be considered for the. Maybe we can be putting it into the limitation of the study, sir.
Okay.
Thank you, sir.
Thank you.
Thank you. Next participant.
Next participant is SR05. Are you ready? Candidate SR0.
Am I audible, ma'am?
Yes, you are.
Okay.
Your time starts
Should
now.
I start?
Yes.
Yes. Good morning to one and all. The topic of my presentation is knowledge, attitude, and practice among physiotherapy teachers on online flipped classroom model, a cross-sectional study. So in the slide, I have depicted a traditional and an online flipped classroom model. As you all can see, kindly please change the slide, ma'am. Please change the slide. Introduction. Flipped classroom is a blended learning approach in which students receive digital lectures as homework while practical application activities are done in classroom. An online flipped classroom works with the same concept where the students receive pre-recorded digital lectures at home through electronic means prior to the actual online class, and the class time is used by the students for online discussions and practical activities with the teacher. The rationale is that students' preparation prior to class enhances the efficacy of learning activities and promotes active learning during the class. Several benefits of a flipped classroom are seen, like increased student satisfaction, interactive learning, increased academic performance, increased class attendance, promotes self-regulated learning, improvement in higher order thinking. etc. Next, within the field of physiotherapy, a review says that use of online technology serves to enhance practical skill performance, knowledge acquisition, and deep learning reflection. However, they reveal that flipped classroom interventions have been little investigated within physiotherapy education. The study is hence carried out to know the knowledge, attitude, and practice among physiotherapy teachers on online flipped classroom model. This will serve as a basis to organize a well-structured and a refined flipped classroom model for physiotherapy students post the results. Next. Need of the study. We have already seen that online flipped classroom has several benefits. However, research reveals adequate knowledge regarding the concept implementation and refining the concept is still warranted, thus making it difficult for educators to determine the effectiveness of flipped classroom. The current study is carried out to throw a limelight on the knowledge, attitude, and practice among teachers to know the existing concepts of flipped classroom. Also, the study will aid us to know the number of faculty employing the technique, the difficulties or barriers in the implementation, and benefits on the execution. So after this, it will help us to make a refined model of the classroom. My aim is to determine the knowledge, attitude, and practice among physiotherapy teachers regarding online flipped classroom model. Objective is to assess the knowledge, attitude, and practice among physiotherapy teachers regarding the online flipped classroom model using a self-made, peer-reviewed, validated questionnaire. Next, data collection from physiotherapy teachers in universities all over Maharashtra, a cross-sectional study, 3 months duration, a minimum of 43 samples fulfilling the criteria. I had taken about 60 participants, they completed the study. Purpose of sampling, inclusion criteria is registered PT teachers in recognized universities in Maharashtra with 1 year of teaching experience. Materials, online Google form with a self-made, peer-reviewed, validated survey-based CAP questionnaire and an online consent form. Procedure. Next, it was a cross-sectional study with a CAP questionnaire involved in making. Ethical committee clearance was taken prior to the study. Registered physiotherapy teachers from all college of recognized university in Maharashtra were enrolled. Next, a self-made CAP questionnaire, that is knowledge, attitude, practice, was made through Google form. The questionnaire was given for a detailed peer review, checked for its content validity, and a final version of the questionnaire was prepared to be used in the study. Google form link was then mailed to the participants without revealing their identity. After completion of the survey, data was analyzed statistically. The outcome measure was a CAP questionnaire consisting of each domain, that is knowledge, attitude, and practice. The questions were relevant and closed-ended, and all completion of questionnaires by the teacher, the results of the study were analyzed post that. Next, the survey will be shown in the form of percentage, in the form of graphical pie charts. 60 participants were actually enrolled in the study, out of which 50 participants submitted completed Google forms through email, which were then analyzed statistically, and the result were expressed in the form of pie charts. Questions in all the 3 domains were assessed. Next. Next, please. So the first domain, that is knowledge. So the willingness to conduct flipped classroom, 72.9% of the teachers had a willingness to conduct it. Next, please. Which of the below mentioned suits with the concept of online flipped classroom? So about 54% opine that it is a teaching method that is going to be lecture content. It will be given prior to the students, digital recorded lectures, and videos would be given later. Then the learning environment is designed to switch focus away from the instruction. Lectures are recorded as videos given to the students outside class, and it is an inversion of the traditional teaching process. Next.
5 minutes are done, ma'am.
Yes, yeah. And then a brief one-word characteristic describing the classroom. So 50% of them opine that it is a way of focused and collaborative learning. Students prepare beforehand on the set topic. Students support student engagement and ownership of learning, and teachers facilitate learning activities. Next. Next, please. Yeah, how will you go ahead with the process of flipping? 48% had mentioned all of the above. That is, you prepare a structured topic of the plan of the topic, give a detailed examination to the students, refer to instructions or published guidelines, and conduct a prior survey about the knowledge possessing among the teachers. Next, online videos. Please, next slide. Online videos and lectures increase the transparency to the parents. Yes, it was strongly agreed by 46%. Next, please. Next, please. Why did you decide to start flipping? So it is seemed varied percentages have been found. 32% says it was everything, that is curiosity to advocate new teaching skills, shifting away lectures and be more learner centered, and to increase student engagement. Next, please. Next slide. Yeah. Do you think this concept students should be oriented prior? Yes, 58% strongly agreed to it. The next was the attitude domain. Can you just change the slide? Yeah.
Yes.
So, yeah, can you change attitude? Can you go ahead? So this was the distribution for attitude. Yeah. Then can you implement it in COVID-19 times? 82% had agreed to yes for it. Next. Next, flipped classroom improves a better relationship with peers and facilitates teacher-student relationship. 44% had strongly agreed to it. Next, can you move ahead, ma'am?
Yes, we are changing.
Yeah. Students who remain frequently absent in the class, do they benefit from flipped classroom? It was strongly agreed by 42%. As it is an online medium and pre-recorded lectures have been given to the students. The last domain is practice. So implementation of flipped classroom, yes, it was agreed by about 18%. Some of them have done it sometimes, 22% occasionally, and 24% had done never. Next. So these are the benefits. There are many benefits as already discussed, and 44% had agreed on. Yeah, please change. Please change. Yeah,
yes,
the last one. And the next slide, please.
Okay, this online flip.
Yeah. Online flipped classroom. Does it have students to prepare doubts before the lecture? Yes, people had agreed for it. And the last slide. Yeah, the next one. Next one, tools used for flipping. Yes, it is shown in the results. Next one, please. Yes. Come on, please, can you go to discussion?
Okay.
Barriers and yeah. So from the above results, considering all the three domains, the discussion is that the teachers are aware about the concept of conducting. However, the study helped us to know the number of faculty employing the technique, difficulties and barriers in its implementation, thus making it imperative to focus on forming a more refined structure of the classroom. So that in the current situation which favors online learning, it could serve as a tool to enhance student-oriented interactive learning. Thus, making 3 C's, that is collaborative, constructive, and removing passive one-way teaching process. So the teacher will not, yeah, thank you so much. The last slide, thank you. Thank you.
Is question answers?
Yes, I have a question.
Yes, sir.
What would you see this mode of teaching in long term as far as our profession is concerned?
Sir, currently in the COVID scenario, the mode is the current need of the situation.
Yes, it's
but
relevant
in
to the current time.
Yes, sir, in the long term, physiotherapy being a theoretical as well as practical, more conceptual and practical profession, the students could be pre-oriented with the practical concepts with online recorded videos, which could be given to them in the form of videos. And then in the classroom, the same could be discussed in a practical format, such as long cases or short cases, or certain mobilization techniques could be shown to them in the classroom. So at least this will help them to have a pre-idea about the concept beforehand.
So would you recommend it for over the disappearance of Corona and all this scenario?
Yes, sir. Even after post-COVID scenario, this would be definitely useful.
Okay.
Seeing its vast applicability, and tool is an online tool. Yeah.
Yeah.
It's a very good study, and I want to take this platform to congratulate all the teachers, because we were not aware about how to use this internet to take the classes. And during, I think Corona has taught us that these are also the new different techniques which we can implement in our teaching. So I really want to thank all the teachers, because it was really a challenge for all of us, and I think we have conquered it. Can you tell me any other teaching, other teaching methodologies which we can use other than traditional techniques and flipped classroom?
Okay. Ma'am, we could even use something called as innovative teaching. wherein which a small paragraph or a small concept is given to the students. Idea, say like if the topic is very vast, like Maitland concept of mobilization. So just a keyword is given to the students, and then they can frame say exercise on shoulder. Suppose shoulder joint is given, so they can tell us all the techniques on shoulder, and the same can be demonstrated in the class in the next when the teacher is in front.
Okay, that's it. Thank you so much. Good presentation.
Yeah. Thank you, ma'am. Thank you so much.
Okay, we'll now move ahead to our next present, CBR SR06. Are you ready? SR06, are you ready? Am I audible? CBR SR06, are you there? Okay, we'll move to our next candidate. SR07, are you ready?
Yes, ma'am, I'm here.
Okay. So CBR SR07, your time starts now.
Okay. Good morning, everyone. My topic is cost-effective ergonomic modification helpful during task-oriented activity in blind elderly? Next. So flex posture commonly increases with age in older women and is characterized by excessive curvature in the thoracic spine, forward head posture, and decline in height. And the biomechanical studies have indicated that improper sitting during any task can elevate motor unit activation levels of the upper back and spinal musculature, causing significantly increased intervertebral disc pressure by placing the spine in hyperlordotic or kyphotic positions. Next. It is extremely important to integrate a visually impaired person into the activities that they like to maintain the quality of life. And principles of ergonomics that have been applied to workstation have shown that greater comfort and lesser expenditure of energy can increase the work output of a person in a variety of situations. Next. So aim of my study was to study the effect of cost-effective ergonomic modification on task-oriented activities in blind elderly. Objectives of my study were to calculate discomfort, sitting time, postural angles during the task-oriented activity and with using cost-effective modification and to compare both. Next. So methodology, a study setting was in blind old age home, and 10 blind elderly from blind old age home which were involved in performing task-oriented activities was selected for the study. They were asked to rate their level of tension or discomfort in neck, shoulder, back, legs, and feet, and sitting time taken in a day for completing the particular activity was noted, and markers were placed on selected points and photographs were taken to measure the postural angles with MB ruler software. And previous, please. They were given a cost-effective ergonomic modification to perform those activities that they were doing in old age home, and the sitting time, postural angle, and discomfort were calculated after 10 days. Next. So the study went something like this. So it went through phases. First was idea generation, feasibility analysis, product was made, prototype was developed, and design was done, and this what followed up. Next. So the idea was generated when we went for an old age home, a blind old age home visit. They were involved in the activities like making baskets or making the garlands. And this person was blind, and we thought that they were maintaining a very bad posture when they were performing the activities. So we thought of creating something for them. Next. So we thought of making something which was feasible, which was cost effective, which was safer. So a cardboard was thought of, and to make some stands of thermocol was thought of, since it will be less injurious and more feasible and very cost effective. Next. The product was specified and prototype was developed. So according to the placement where they were used to keep scissors or forceps, and they were used to keep the boxes of beads. So a prototype was made something like this on paper and was implemented. Next. So this was a prototype which was developed initially. A cardboard was made which had compartments to keep the boxes of the beads and scissors and forceps. And it was noticed that when this cardboard was given, we noticed that we didn't take into consideration the thread part of it, which they had to entangle to the toe and then use. So we wanted to modify the product. Next. So the product was modified, and we had given the extra compartments to the cardboard, because they also said that sometimes when they're sitting for 2 hours continuously, they want to extend the legs. So we gave 2 extra compartments. So if in case they want to change the boxes to the other compartment, they could, and they could extend the leg. And a portion was given to put the thread to that hook. Next. And later the stands were added to the cardboard. It was also sealed with a black tape, so that there are no sharp corners to the cardboard, and the stand was given so that they maintain the posture properly and they could easily extend their legs. So this was the final product which was developed. Next. So this is how they were sitting earlier when they were performing the activities in blind old age home. And this was after the first cardboard was made. Next. This was after the stand was added to it. And the last thing was they were asked to, for low back region, they were asked to take the support of the bed and put a pillow to it. So this was the final position which they were.
Ma'am, 5 minutes are done.
Yeah, so this was the final position which was told to them. The marker was placed and the postural angles were calculated through the markers. And it was observed that the postural angle was much better than how they were doing it previously. Next. So as I said, the cervical angle and the thoracic angle was found to be much better than previously. Next. Sitting time. So earlier they used to do the work for 4 hours in a day. Later on, after giving the cost effective modification, they used to sit for 5 hours, one more extra. They could earn more money because of it, and they were able to sit very much at ease for 1 more extra hours in a day. Next. Discomfort during their activity. So earlier it was found that they had tension or discomfort into the head, neck, lower back, and leg or foot region, which was significantly reduced after giving an ergonomic cost-effective modification. Next. So conclusion was that cost-effective ergonomic modification is helpful to reduce discomfort in neck and lower back for maintaining better posture during task-oriented activity in blind elderly. And it also helped to have better postural angles while performing the activity, and they could sit very much at ease with the cardboard ergonomic modification. Next. So future scope of the study. This study is currently in progress, but advantages and disadvantages of given modification can be studied for a long-term use, and different customized design can be made for basket makers, because the elderly which are there that are involved in making garlands or baskets, so they make different stuff. So different ergonomic, different customized design can be made for them. Limitation of the study. So markers were placed on the clothing at certain places, so they could have affected the accuracy in the measurement. And there are a lot of visits and activities that run into that old age home. So the activities and programs at blind old age home would affected the performance of overall activities, which they were engrossed in performing these baskets, making these baskets or garlands. So the activities in there affected this overall performance of the activities. Next.
Time is up.
Yeah, thank you so much.
Thank you.
Thank you.
Question answer session.
Yes, it is a very good study intervention where
Thank you, sir.
getting the performance of the old blind people, the blind people. But as such, what exactly limitation did you find, or do you see as a result of the activities which are running at the blind home?
Because they were visits, they have to gather into the activity hall and they have to attend the session. So that affects the performance of the activities which they do. So because they have to completely attend the session, if there are some visitors, they have to go and attend, or there are some school students which who come to the visit, so they have to go and attend those sessions. So that affects the uh, time duration of the activities that they do into this like making garlands or making baskets. And this is like an earning option for them. The more and more stuff they make, they also get some amount of earnings through this.
Okay. Thank you.
Thank you, sir.
No question from my side.
Thank you, ma'am.
Next is CBR SR06.
Are you able to unmute your?
Are you able to unmute yourself? CBR SR06. Hello. CBR SR06, are you there? Okay, we'll move ahead with CBR SR08. Next candidate, please be ready. CBR SR08. Is the screen visible?
Yes, yes. Hello. Am I audible?
08, right?
Yes, yes.
Okay, you can start. Your time starts.
Okay. Good morning, all. Today I'm presenting the prevalence of pregnancy-related anxiety in pregnant women in southern fringes of Pune. Next. Yes, pregnancy is the time of joy and hopeful expectation. Although it could also be a friend with worries and the anxiety about the physiological and the emotional changes that takes place during this time. While depression and anxiety are the commonly occurring mental condition during the pregnancy, evidences shows that the anxiety is more common than the depression, though it goes hand in hand. Pregnancy anxiety is defined as the negative emotional state that is associated with worries about the health and the well-being of the one's baby, the impending childbirth, then the concern about the hospitalization and the healthcare experiences during the birth and the parenting and the maternal role. In our country, more importance is given towards the address.
Ma'am, you are not audible.
And the mental health receives less attention. Symptoms suggestive of a disturbed mental health, such as poor sleep and tiredness, are likely to be ignored and attributed to the normal physiological condition associated with pregnancy. There is ample evidences that anxiety and similar mental conditions during pregnancy could increase the risk of adverse pregnancy outcome and offspring neurodevelopment. The adverse outcome include low birth weight, prolonged labor, preterm delivery, and higher incidence of the cesarean section. Need of study, though, though there are evidences that anxiety and the similar mental condition during pregnancy could increase the risk of adverse pregnancy outcome, still the published literature on the anxiety during the pregnancy seems to be limited. It is essential to determine the true estimates of the prevalence of pregnancy-related anxiety, which further can be utilized as the evidence by the researchers and to develop the strategies for the detection and the management of the maternal anxiety. Yeah, the aim of my study is to find out the prevalence of pregnancy-related anxiety by using pregnancy-related anxiety questionnaire revised version in the pregnant woman. Next. Objectives of my study is to find out the fear of giving birth, to find out the worries about bearing a handicapped child, and to find out the concern of own appearance. Okay, so my study is the observational study. Then the pregnant women were involved, and the sample size was 70, and the sampling method was the convenient sampling. Yes. Next slide. Yes.
I have to.
Yeah. Inclusion criteria: the woman with 21 to 35 age group, then woman who has the healthy pregnancy with the low risk pregnancy, then primary gravida and the multigravida are included, then women with the medical conditions like hypertension, diabetes, and the high risk pregnancy were excluded. Next. Yeah, the ethical approval was taken, then written consent from the patient was taken. And participants were selected according to the inclusion and exclusion criteria. Then the questionnaire was explained to the participant, then participant filled the questionnaire, then responses were recorded. Next, the data were collected, then analyzed by using the MS Excel. Descriptive statistics were reported using frequency and the percentage. Next. Yeah, in results, in my study, I found the primary gravida 43% and the multi-gravida 57% with the age group, mean age group of 25.5 years and with standard deviation 3.6. Yes, next. Yeah, 21% of women had miscarriage history and 11% female had the history of that child. Then in my study, 19% were women were in first trimester and 57 women were in second trimester and 23 in third trimester. Yes, next. Yeah. So prevalence of pregnancy-related anxiety on pregnancy-related anxiety questionnaire revised version. So I found that 74% women has the anxiety related to their pregnancy. Next. Yeah. So in next, the 86% of the female, they have the fear of giving birth, then worries about bearing the handicapped child and the concern about their own appearance. 87, excuse me, go please. Go back, please. Yeah, and 87% has a fear of this worries about bearing a handicapped child and the concern about their own appearance, and 98% female were concerned about their own appearance. Yes, next. Yeah, score of the this anxiety questionnaire, that the mean of the
5 minutes over.
Yes, fear of giving birth is 7.5, worries 7.2, then concern about the own appearance 8.1, and the total score was 25.24% with standard deviation 6.8. Next. In this study, 70 participants were recruited. 90% women were in first trimester, 57 in second, and 23 in third. The mean age of the woman was 25.5 years. Then 83 were primary and 57 were multi-gravida. Yes, next. Yes, I found the prevalence of anxiety in the pregnant woman was 74%. Then next. Yes, in this study, we found that 86% women had fear of the giving birth. Say 87 were worried about their bearing the handicapped child, and the 98 were concerned about their own appearance. Next. This can be explained by the fact that there are many hormonal and the physiological and the psychological changes during the pregnancy. Also, the pregnancy and the childbirth are perceived by some pregnant women as a moment of the vulnerability, capable of triggering the feeling of fear in the woman, which can be present even in women who have experienced previously. Next. The feeling of fear can be exacerbated with the approaching moment of the child's birth, even though it is expected throughout the gestation, thus predisposing the pregnant woman to changes in their psychological well-being. Since the literature demonstrates that the women who are afraid of the childbirth may be at the greater risk of developing anxiety during the pregnancy. Next. The presence of the complication in the previous pregnancies and the history of abortion risk of preterm birth were also shown to be a risk factor. Then this Anita Nath, she says that the financial status, family conflict, addiction,
1
and the
minute
family
remaining.
suffering, yes, are also responsible for the pregnancy-related anxiety. Next. No. Hello. Yeah, there is conclusion ka slide. Yes, the prevalence of anxiety was fairly high in the study population. Fear of birth is there, and the worries about the bearing a handicapped child and the concern of the own appearance was there. Next, clinical implication. The findings from this study have significant implication for the healthcare organization. Antenatal anxiety must be taken care as a top priority to reduce the adverse pregnancy outcome. A formal antenatal screening. The formal antenatal screening for the pregnancy-related anxiety should be part of the routine antenatal checkup to identify the risk group for the pregnant woman with the pregnancy anxiety.
And time up.
Yeah, thank you.
Question and answers, please.
Very good presentation. Can you tell me that because in your discussion and conclusion, you have mentioned about the screening during antenatal period, but as a physiotherapist, what are the interventions that you can do to reduce the anxiety during antenatal period?
Yes, ma'am. As we know, the exercises are also important during the pregnancy. If the participant or the pregnant woman are involved in the exercises, there is opioid-like substance which gives the feeling of well-being. That is also beneficial, and we can give the some yoga postures to the female. Then the relaxation techniques are also good for the reduction in the anxiety.
Yes.
Okay.
I have a question.
Yes, sir.
Yes. So how was the scenario, anxiety scenario different in primigravida and multigravida?
Actually, sir, the multigravida female, they are more concerned about the appearance because they have gone and undergone the 2 or 3 pregnancies. In the primigravida, they are more concerned about the this thing. Bearing a handicapped child or bearing or the premature labor, or sometimes they are they have anxiety because of their this physiological changes like vomiting and all this thing. So it is differ on the 3 different components, that is fear of the bearing, and some have the bad experience in their past, so the multigravida, they have fear of that past experience also. Hello.
Should we move ahead?
More questions?
Yes. If there are no questions from anybody else, then we can move on.
And,
Thank you, sir. Thank you, ma'am.
next candidate, CBR SR 06. Please be ready. Sharing your PPT. Are you there, CBR SR 06? Hello. CBR SR 06. I think he or she is not there. We need to move ahead with the next one. CBR SR 09. Are you there, CBR SR 09? CBR SR 09. We are sharing your PPT. CBR SR 09. Are you there? CBR SR 09 is not there. If we move ahead, there's CBR SR 10.
In the chat box, there is some chat related to, I want to mute, maybe it is from a presenter.
Okay, just 1 minute. Piyush, are you there? Can you unmute CBR SR 09?
Hello.
Hello. Madam, you have not changed your name. You had given instructions repeatedly.
Yeah, I have changed. Change it again. Sorry.
CBR SR 09. You start with the presentation now.
Good morning. The title
Time starts now.
The title of my presentation is The Perception of Physiotherapy Students Towards Focus Group Discussion as a Teaching Learning Method. Next. Usual types of didactic lectures or PowerPoint reading are not favored by students and cause boredom. In conventional teaching and learning methods, the classes are teacher-centered with limited students' participation and minimum on-task peer interaction. So maintaining students' attention and engagement can be difficult during lectures at times. So according to the researchers, academicians usually have limited awareness of students' requirements, level of knowledge at either an individual or class level. Next. Next, please. Next, please. Next slide, please.
Am I audible? I have changed the slide. Can you see that?
No, it's still on the first slide. Yeah.
Is it? Is it
Yeah,
now?
now.
This is the slide.
Yes. Consequently, students get fed up and get distracted from classroom objectives and indulged in activities such as doodling on their lectures notes or using social media on their mobiles or laptops. A major concern in colleges is absenteeism and students showing disinterest in conventional classroom teaching. So this will consequently have unfavorable consequences on social morals, health status, and efficiency of the nation. And therefore, it is important that these issues has to be taken into account. Next. So increasing awareness about the process of learning to achieve an outcome is important. So there is shift towards outcome based education, and redesigning of the health profession curriculums with new pedagogical approaches has been necessary to ensure the students acquire appropriate clinical knowledge along with practical, procedural, and communication skills. It is perceived that it is essential to increase the involvement of students by inducing active interaction during lectures by innovative teaching and learning methods. Focus group discussion is one of the pedagogical approach which leads to active participation of students and used to achieve educational outcomes. Next. A focus group is a small gathering of persons who have common interest or characteristics, and it is assembled by a moderator who uses group and its interaction as a way to gain information about particular topic. Benefits of FGD are it is easier to implement than other qualitative methods, allows exploration of topics according to the researcher's interest, and generate various new hypotheses. Next. So active learning provides encouragement to the students leading to enjoyment and has positive impact on their performance and helpful to achieve educational outcome. Next. Hence, the study was planned to study the perception of students towards focus group discussion as a teaching and learning method. In methodology, the study design was cross-sectional observational study. Inclusion criteria was physiotherapy students between the age group 18 to 22 and who were volunteering to participate. Randomly allocated groups were made and total 104 students participated in the study. Next. The students were explained about the concept of focus group discussion. Students were divided into two batches as per their educational year, 42 students and 62 students. Brief introduction was given to award the participants by separate topics of FGD were selected and preparation time of 1 week was given. The resources of library internet were made available with principal permission and facilitators were provided for students' guidance. Next. So setting was large lecture hall with infrastructure like dais, comfortable chairs, microphone and speaker were given. Students' pre-library time was used so that students didn't have to miss their lectures, and each group was called on the dais for focus group discussion of the selected topic turn by turn. And the other groups, those who did not participate in that particular topic were the audience. And discussions were facilitated by the moderator and lasted for around 45 minutes to 1 hour. Next. All the discussion activities were noted by investigator to record the discussion, behavior and responses of the participants. At the end of the focus group discussion, the questionnaire, which was self-structured, was provided to all the participants. The questionnaire was validated by the member of Medical Education Technology Unit and Research Cell Unit. Next. The questionnaire was blind and did not ask for identification, and it was there to maintain strict confidentiality of the students. There were total 12 questions and it was a Likert scale starting from strongly agree to strongly disagree. Next. So in results, first question was you are comfortable with FGD. So among them strongly agreed students were 39, whereas 15 students were neutral. FGD enhances the reasoning ability and skills of students was strongly agreed by majority of them. FGD increases the confidence in expressing oneself was strongly agreed and agreed by majority of the students. FGD leads to optimum utilization of time was strongly agreed by many, and some of them were neutral. You can see the number. Then FGD overall environment generated by FGD is conducive for learning was strongly agreed by maximum
5 minutes
students.
over.
Yeah, next slide, please. Next. So average of these responses of the perception of student toward newly introduced concept of focus group discussion showed that 85.3% of students were expressing positive response towards focus group discussion. Only 0.4% disagreed with the concept and 14.13 remained neutral. Next. So students are not actively involved in traditional way of teaching. So teachers provide little or no feedback, and there is a passive transfer of lecture content to the students instead of promoting the discussion. So this results in disinterest, dislike, boredom, annoyance, and poor self-regulation exhibited by the students. In cooperative learning, students work together in small groups and their personal intelligence increases along with the increase of group's collective intelligence. There is another study supporting this result that group learning allows learners to gain higher abilities when they have lower abilities, and they are respected as they are allowed to self-learn. Next. The topics under discussion may not be liked uniformly by everyone. A uniform learning skill that needs traditional teaching, and some students found it difficult to be active all the time and be critical thinkers. Also, another study done by Dreff et al. Found no difference in knowledge attitude between the students in two sections of the same class, one taught with traditional lecture method and the other active learning methods. Student may perceive the instructor to be more organized or structured with lecture method. Next. As reported by various studies on the basis that retention of knowledge is better due to development of self-directed learning skills, it helps to develop attitude and professionalism. Students value the opportunity to discuss the content rather than passive learning, and two-way communications assist in learning process and aids retention. Through interaction, a high level of cognitive learning and communication skills are achieved. Next. Active and self-directed learning will contribute positively to learning outcomes. Benjamin Franklin's words of wisdom support the advantages of active self-directed learning by a phrase that tell me I forget and teach me I may remember, involve me I learn. In conclusion, next, the perceptions were recorded strongly supportive to the FGD, which improves overall performance of the students as it generates healthy, non-threatening atmosphere. Next. So author strongly wants to recommend that this method can be implemented as a regular feature of undergraduate teaching in physiotherapy. Next. These are the references.
Question answers for 2 minutes.
Yes, it's a good study. How? What would you think that it may restrict us from implementation, though it is a good method of teaching, but what would be the drawbacks and what would be the difficulties in practical implementation of this?
Sir, in practical implementation, sometimes discussion takes a form of argument. So sometimes students get overexcited and then they start arguing instead of discussing. So it becomes difficult for the moderator to control them. So,
now, as far as the administrative restrictions, limitations are concerned?
yes, sir. Means sometimes traditional ways of teaching are preferred over this self-directed learning because students may feel that they are not given proper attention by the faculty members, and they want proper guidance from the faculties.
Okay. Yeah. Thank
No
you.
question from my side.
Okay, to move ahead, CBR SR06, are you there?
Yes.
Okay, we'll be starting with your presentation. Your time starts now.
So my today's topic of paper presentation is effect of whole body vibration training and exercises on pelvic floor muscle strength, severity of incontinence in female with urinary incontinence. It's a pilot study. Next. Incontinence, as per the International Incontinence Society, is a definition. Involuntary loss of urine is the ideal definition. Then involuntary leakage of a urine on effort like exertion while lifting weight tends to increase intra-abdominal pressure, and urethral sphincters are unable to maintain this pressure, and thus it leads to involuntary leakage. That tends to cause, this is one of the definition as a stress urinary incontinence has. Now, urinary incontinence is common problem among the women due to hesitation. They do not come up with the problem, and it isn't so social issue which causes social isolation to avoid embarrassing. Please. India has a high prevalence of urinary incontinence, which ranges from 10 to 34%. Recent study published in International Journal of Urology that that there is a 21.8% of prevalence present among female. Pelvic diaphragm is responsible for many functions of pelvic floor activity. These muscles are approximately consisted 70% slow twitch fiber, 30% fast twitch fiber. They respond to quick stretch. Next, please.
The pelvic floor muscles are truly extraordinary
Now
because they
these muscles are multitasker as we are.
functions above. There are so many reasons
Next,
why it
please.
is worth being proactive about.
Whole
Other
whole
video
body
is on in the
vibration.
background. Continue.
Whole body vibration is a new intervention aimed for improving muscle strength, endurance, and neuromuscular conditions. Accordingly, whole body vibratory plate movement enhances proprioceptive excitation, transmit forces through neuromuscular, skeletal, and facial interconnection to balance the center of gravity and feeding subconscious mobility and the stability. Thus, it is we have found out that this could be a new intervention in the rehabilitation of pelvic floor muscle. Next, please. Next slide.
We have changed this.
We have changed, ma'am.
Aim and objective to assess and compare the effect of whole body vibration training and structured pelvic floor muscle exercises with conventional pelvic floor exercises, meaning Kegels, on pelvic floor muscle strength and severity of incontinence. We in females control group. Next.
Hello, ma'am. Your net connection is not unstable. Hello. Hello.
Female diagnosed with. Yeah, am I audible?
No, your voice is breaking. Right now it is. Hello. Hello. You're not audible, ma'am. Am I audible to other panelists and judges? We'll take this presentation again. I think her internet connection is unstable. Next person, CBR SR11, be ready.
Hello.
CBR SR11, are you there?
Am I audible, madam?
Yes. CBR SR11, are you there?
Yes, present. Hello.
Yes, just wait for a minute.
Okay.
Okay, CBR SR11, we are starting with your presentation. Sharing your PPT. The time starts now.
Okay. Very good morning. And my today's topic for presentation is to study the utility of reference article versus use of reference textbook in studying topics by student and by the professionals. Next slide, please. Introduction and explanation or research article is an essential source that it reports the strategies and consequences of a unique examination performed by the authors. The strategies area where author describe how they collected and analyzed the data along with the statistical analysis. In the current scenario of competition and advancement, being a physiotherapy student or professional, it is must to know which all are the recent changes, suitable modification, and advancement that are happening in our physiotherapy community. So, referring research article will be useful in studying specific topic in a short period of time, along with its advances in recent trends. Recommended and reference textbook are the traditional and very useful form of learning which allows the student to learn all the topic at single station. As the textbooks are in printed form, students learn the topic much easier than any form of learning. As in a recent trend, every day there is something new emerging in the market which textbooks cannot cover. So the study is all about how many students and professionals are referring research articles for studying topics and what all are their views related to research articles. Next slide, please. Need for my study is being a member of physiotherapy community. It is evident that research is the vital form of advancement where we are lagging, hence research is important. Reading professional publication is important and it is the first step towards doing the research work. As in current clinical practices, most of the professionals are still confined to conventional treatment, which is important, but the recent advances along with conventional training shall aid in gaining speedy result. Although reference textbooks are useful for studying and clarifying student doubt, but they are lacking in gaining the updated study material which are currently going on in the community. Next slide, please. This article aims to study the utility of reference article versus use of reference textbook in completing the topic by student and by the professional. Objectives are to determine the use of reference research articles in studying the topics, to determine the use of reference textbook in studying the topics, and to determine which form of treatment approaches that professionals are using. Next slide, please. Methodology. Study design was observational with the cross-sectional type of study. Sampling method is actually I can't see there is something in between the screen. Simple randomized sampling with the 300 samples. Participants are physiotherapy final year student, PGs, and the physiotherapy professional, and the place of study is Vidarbha division. Inclusion criteria are a study with a group of 22 to 56 students from final year, first PG, second PG, physiotherapy professional, and subjects who are willing to participate. Exclusion criteria are subject from third year and less, and other medical professionals. Next slide, please. Procedure. For the present study, ethical committee approval was taken. The study was conducted in Vidarbha division. According to inclusion and exclusion criteria, 300 subjects were selected by using simple randomized sampling method in the study. A self-administered questionnaire was been given to subjects via internet. A participant guideline program was conducted via telephonic interview in which brief detailed explanation about the questionnaire was given to the subject. A self-administered questionnaire was being structured with the help of senior faculties who are involved in the research work. Next slide, please. The questionnaire consists of 8 items regarding the preferred and convenient way of learning any particular topic. Also, it is related to various treatment approaches they are following in their clinical practices. The subject were supposed to carefully read and understand and complete the given questionnaire, followed by submitting it back to the researcher. Next slide, please. Data analysis showed that there are total 127 males and 173 females were present in this study, which is 43% and 53%. The age group and the participant, there are total 36 participants, age group of 22 to 26, 49 in the 27 to 28, 62 in 32 to 36, 58 in 37 to 41, 55 in 42 to 46, and 25 in 47 to 51, and 15 in 52 to 56 respectively. According to questionnaire for completing of any topic, which form of learning do you prefer? 180 participants claim that they use for research reference textbook. 75 participants said that they use research article, and 45 subjects said that they use both form of learning. Next slide, please. During the time of treatment, what approach do you prefer? Out of 300 participants, 153 said that they go for conventional approach, 57 said that they go for advanced approach, and 90 subjects said that they go for combination of both the approaches. Discussion. In the present study, we have focused on which form of learning physiotherapists are using to study along with the recommended textbooks. Although physiotherapy is a very old field in the medical profession, it came into limelight after 1916, and after 1940s, advancement has been taken place. Traditionally, recommended textbooks are the gold standard method of learning process. Although reference books are also considered in learning process, it is essential for all of us to be updated for enhancement and development of our knowledge and profession. By emphasizing more on the reference article, which consists of advanced material required. Next
5
slide.
minutes over.
Next slide, please. Next slide, please. So, new approaches from the point of learning, teaching, and implementing in the form of various treatment protocol has to be given equal importance along with the conventional knowledge, as book writers and publishers print a revised version of any book in the time span of 1 year or more. Within that time duration, many research articles become available on the public domain along with many advancements. As per observation and result, total 300 therapies were taken, 153 prefer conventional approach, 57 said that they go for advanced approach, and 90 said that they go for combination of the both. So advancement which is happening in the community has to be taught along with the conventional knowledge. Next slide, please. Conclusion: based on the data analysis and interpretation, it can be concluded that studies, students and professionals are using reference textbook along with the recommended books for studying topics, and less subjects are using reference research articles. So there has to be a criteria set by the institution that student should read research article as it consists of advanced reading material. The limitation for my studies: there are less sample size were assessed and subjects were not homogeneous. Next slide, please. These all are my references. Thank you.
Question answers.
It's a very good study because generally, if we want to really enhance the research culture, we need to have or we need to read more of reference articles. What are the difficulty that you have faced while searching the reference articles? Because there are many reference articles which are paid, and there you cannot get the full text. So how you have overcome this?
Actually, madam, we have used actually there are less studies related to my topic. So we have studied, we have taken the research article which have used that OCR form of learning and with the OCR and textbook. So we have taken that form of article, and in terms of paid articles, we have used that university, like we have got the this thing username and password which we can use for paid articles, to use paid article and to study them. So such articles related to this topic, there are less articles present in the public domain.
Okay. Because even the payment of those articles, it is in dollars and euros.
Yes. Actually, we have a subscription for many journals like archives.
Okay.
Like yes, ma'am. That's
okay.
right.
Okay.
So, how would you think that it would be more made practical and implementable? Whatever are the findings of your study?
Actually, sir, my findings from my studies showed that there are the PGs and the fourth year students, they said they go for textbooks, not for the research articles. So generally they जो वो लोग सीखते हैं सर वही वो practical knowledge में apply करते हैं. So we have to incorporate and we have to teach them go read research article. That's उसके साथ में वो then they can combine their knowledge and they go for combination of the both or go for advanced approaches.
Okay. So your target population would be fourth year and PGs.
Fourth year, PGs and professionals also.
Okay. Yes. Okay. Thank you.
Okay, sir. Thank you so much.
Thank you. The next participant is CBR SR06. We'll be starting again with your presentation. And after this, we'll be moving ahead with a presentation in junior category CBR. So you all have to be ready with the same. We'll be starting with CBR SR06 till then. Are you there, CBR SR06? Hello, ma'am. CBR SR06. Piyush, can you help me unmute her?
Can we start her presentation from where we have stopped it, because we are running short of time?
No worries, ma'am.
Yeah.
Yeah. Is she there? But CBR SR06, are you there? Piyush, can you unmute her? She's not able to unmute herself. Okay. CBR SR11, are you there? 10. Sorry, CBR SR10, are you there? CBR SR.
Hello.
Hello.
Madam, am I audible?
Yes, you are.
Yes.
CBR 06. We'll start with your presentation. From where we stopped, we'll be starting from there. Am I audible to you, ma'am? Yeah.
Ma'am, am I audible?
Yes, you are.
Okay.
Please start.
So material and methodology. The study design is randomized control trial, and we have conducted a pilot study. Study target population is a female diagnosed with urinary incontinence. Sample population is female diagnosed with urinary incontinence above the age of 35. Sample method, simple random sampling. Sampling technique, computerized random allocation. Sample size 20. Inclusion criteria. Subject those who are willing to participate. Female having age of 35 years and above. Subject who diagnosed with stress incontinence. Good cognition. We have associated on medical. Forward reach chair. This is about 7 inches.
Ma'am, can you move closer to your mic?
Patient with congenital urinary abnormalities. Patient who cannot able to perform exercises. Acute urinary tract infection, chronic constipation, urogenital infection, pregnancy and postpartum pregnancy 8 weeks were excluded, and medication leads to incontinence, musculoskeletal impairments. All these subjects we excluded. Next, please. Material, consent form, performa, whole body vibration platform, perinometer, frequency chart, KY jelly and gloves were used. Next.
We are not able. Just give.
We aren't able to hear you, ma'am.
Hello.
Cannot change the slide. Yes. Okay, outcome measures.
Outcome measures, perinometry was done, and for incontinence, frequency chart was taken. Procedure, reticular clearance was obtained from institutional ethical committee. CTRI registration has been done. Initial assessment was performed, and based upon inclusion and exclusion criteria, 20 subjects were taken and further divided into 2 groups by using random allocation method. Procedure was explained and written informed consent was taken from the subject. Demographic data was assessed, history and presenting symptoms were recorded. Next slide, please. This was a vibratory platform we used for the patient. Next, please. Group A was given some full body vibration training and structured pelvic floor muscle training, and there were control. Group B was control group. Conventional Kegel exercises were given. Whole body vibration was given for 10 minutes initially, for 3 times a week, and such a way 4 weeks protocol was administered.
5 minutes over, ma'am.
Pelvic and frequency was increased. Result and data analysis, 20 participants were included and 10 were divided in 2 groups. Primer of biostatistic version 7.0 was used in the study to calculate mean, standard deviation and statistics within the group. And 95 CI was kept, considering statistical significance P less than 0.05. Next slide. Demographic age, mean age was 41.2 for group A. And for group B, it is 42.1, which is statistically insignificant. Pre-post perinometer score says that on perinometry assessment that group A was showing better effect with whole body vibration training and structured exercises. pre and post perimeter score for group B, which says that group B was having less effect with only Kegel exercises. This could be due to the non-follow-up of other group of exercises. Next. Frequency chart shows that frequency of urination in group A has reduced. Next. Group B shows that frequency chart for Kegel exercises has shown that Kegel exercises can be useful. On statistical test, we have used the student test. Mean score p-value was 2.449, p-value was 0.002 for group A, and B shows 4.965, and p-value was less than 0.037. And on unpaired t-test, severity of incontinence, statistical t-test within group and between group comparison have shown.
Only 1 minute left, ma'am.
Next. Next. Now on discussion, next please. Conventional physical exercise, whole body vibration training might be effective. Next, next slide. Conventional physical exercise associated with increase in the strength and endurance in pelvic floor muscle increases endurance, which translates to better holding capacity and hence causes the less episode of leakage. Next slide. Now, the whole body vibration training creates harmonic vibration, which facilitates proprioceptive excitation, enhances the subconscious muscle memory through the increase neuromusculoskeletal feed forward and feedback like eliciting sonic vibration reflex, as well as vibratory platform creates a stimulus which excites the slow twitch fibers, which is more over. That's why
Madam, you have to stop.
What it means.
Time is over, ma'am. Time is over. We can have question answers.
How your study can be implemented in a community setting?
In community setting, whatever tools or exercises, protocol, what we are having, we can carry this whole body vibratory platform in the portable models also. We can implement it. They are very cost effective, and the outcome measures what I have used in my study, those are easily feasible. The target of this kind of study so that we can cover maximum women, those who might have a chances to develop pelvic floor muscle pathology untreated and then even unattended. So the idea was basically carrying out global vibration platform is it is an easy and cost-effective model, and portable models are also available. At the same time, it has its own structure where people can see the frequency and the intensity of what they can approach to with the periodic vibration.
Any questions, sir? Dr. Basaraj, any questions?
No, madam, no question.
Okay, we will be now moving ahead to junior categories. Judges, should we take a break for 5 minutes?
What about this CBR 10 presentation?
He has not joined.
Okay, okay.
So should we move ahead or should we take a break for 5 minutes?
I think we can go ahead from my side because many presentations are remaining. Yeah, yeah.
Sir, shall we move ahead?
We can take just break of 1 minute and we'll be back.
Fine.
Okay.
Just 1 minute.
Yeah, yeah.
Meanwhile, JR02, please be ready. Shall we start, ma'am? Judges are ready. Can we start? Can we move ahead? Are the judges ready?
39%.
Okay, we'll wait for another minute.
Okay, welcome back. We'll be starting with junior category presentations now. Dipali ma'am, can we start? Basauraj sir, can we start?
Yes, madam. Yes.
Dipali madam, are you there?
Right now, so in the senior category, 10 was not there, no?
No, 10 wasn't there.
Hmm.
So in junior category, to start with, we have our first presenter. We'll wait for Dipali ma'am for another minute. She just gave a confirmation on call. So she should be back in 1 minute. Dipali ma'am, are you there? Okay, so we'll be starting with our junior category presentations. Dipali ma'am, should we move ahead? Okay, so our first presenter is CBR JR 02.
Ma'am, am I audible?
Yes. Your time starts now.
Good morning, everyone. Today, title of my presentation is Reliability of Gujarati version of the Quick Exposure Check in Clerical Workers. Next. Introduction. Globally, musculoskeletal disorders is the largest single cause of work-related illness, accounting for over 33% of all newly reported occupational illness in general population and are the second most common cause of disability worldwide. So, quick exposure check is an instrument that evaluates occupational risk factors. Next. There is total 16 questions which are distributed in two columns. First column contains the observer's evaluation of the posture adapted and the frequency of the movement performed by the cervical spine, lumbar spine, shoulders and arm, wrist and hands. The second column contains the worker's opinion about the amount of the weight handled and the time necessary to complete a given task, the level of hand force exerted, visual demands, vibration, driving of the vehicles, working pacing and stress. So the total quick exposure check score combines the response of both, that is evaluator and the worker. The total score is calculated from the observer and the worker scorer with a range from 46 to 269 points, with the risk profile categorized as low risk, that is 46 to 84 points, moderate risk, that is 106 to 138 points, high risk, that is 168 to 198 points, and a very high risk, that is 187 to 242 points. Need of the study. Use of the English version may lead to misinterpretation of the items, particularly where the workers are concerned, as most lack the English language proficiency to understand the questions. The purpose of this study was therefore to translate the quick exposure check in the Gujarati, so later on it can be used to assess their work-related musculoskeletal disorders risk exposure. Methodology. Source of the data: bank, schools, and government offices of Ahmedabad. Population, clerical workers. Study design, observational study. Sample technique, purposive sampling. Sample size, 30. Duration of the study, 2 months. And outcome measures is quick exposure check. Method of Gujarati translation. Developers and authors of quick exposure check were approached with proposals to translate it into Gujarati language. Quick action translator who were native speaker of Gujarati language and fluent with English language. First translation copy was reconciled from 2 translated copies and report was prepared for required changes. Translation of first copy back to the English by independent translator. Next, documentation of difference between the translated copy and the original English version were documented. Process of forward, backward, forward translation continued till acceptable second Gujarati copy was obtained. Second translated copy was given to the 5 experts and each item was analyzed as accepted, accepted with modification or rejected. Report of item requiring modification was prepared and modification till the item reached to the common consensus. After all modification, the final version of Gujarati translation was prepared and Gujarati version of the quick exposure check was assessed in 30 clerical workers. Inclusion criteria. Age group is between 25 to 58 years. Both male and female can participate. Working at least 5 hours per day since 12 months and willingness to participate. Exclusion criteria. Any type of neurological disorders, subjects having any type of deformity, any type of recent orthopedic surgery, and recent trauma within 6 months, pregnant woman. Results. Cronbach alpha was calculated for internal consistency and the value found was significant. Cronbach alpha value is 0.721. Discussion. Clerical workers is particular may involve frequent repetitive motion and prolonged sedentary and static posture, and this will lead to development of the work-related musculoskeletal problems. So, quick exposure check is an observational method with the combination of the worker's answer with the observer's perspective simultaneously in the assessment. Item K asks the worker to estimate the maximum force level exerted by one hand and this can be very difficult. As this estimation was very subjective, the worker may have found it difficult to provide a consistent response across the assessment. Therefore, the reported weight of the load or force exerted by the worker may be over or below the actual task demand. Therefore, the observer should take note of this. Though the questionnaire, that is quick exposure check, has been translated into many other languages, but till date, no Gujarati version of the quick exposure check or questionnaire was available. And in this study, the Cronbach alpha value found was 0.721, which was significant. Thus, interpreting that the Gujarati version of the quick exposure check is reliable to evaluate the work-related musculoskeletal disorders among clerical workers. So, conclusion, the Gujarati version of the quick exposure check is reliable to evaluate the risk factor for work-related musculoskeletal disorders among clerical workers. Next, clinical implication. Gujarati
1
version
minute is left.
clinical implication. Gujarati version of the quick exposure check can be used to evaluate the risk factor for work-related musculoskeletal disorders in Gujarati-speaking population. These are the references. Next.
Okay. Question answer round.
There are various scales available to evaluate the ergonomic risk factor during work. So why you have taken specifically this scale?
Ma'am, because there is a ruler, but it is very long process. This is a quick exposure check, and it takes only 10 minutes. And we have to observe the worker to fill this scale. So it takes only 10 minutes, and it is very helpful to evaluate the work-related musculoskeletal problem.
Okay.
Any question from Dr. Basavaraj?
No, madam.
Okay. Now we will move to our next candidate, JR03. Are you ready?
Yes, ma'am.
Okay, I'll share your screen. Your time starts now.
Okay. Good morning, everyone. My presentation topic is comparative study between effectiveness of resistance training and aerobic training in polycystic ovarian syndrome. Next, please. Yeah. So introduction, polycystic ovarian syndrome is a common disorder which includes endocrine symptoms chiefly affecting the women at reproductive ages. Exact cause is unknown, but can be caused by imbalance of female sex hormones. So the Indian adolescent adolescents have 9.3% of prevalence and 3.7% in young women is the Indian prevalence. PCOS includes in irregular menstrual period, hirsutism, dysmenorrhea, and obesity. Obesity related to PCOS increases the androgen and excess blood insulin levels, causing hormone imbalance and worsening the symptoms of PCOS. Various studies concluded that the weight reduction may lead to an improvement in reproductive function and may improve metabolic rearrangement in PCOS. Irregularity in menstrual symptoms, menstrual cycle and ovulation seems to be improved in 50% of women who are given exercise training. The benefit of resistance training and aerobic training were seen individually, but so the main objective of this study was to compare the effectiveness of resistance training and aerobic training exercises so that we could use it for further intervention. Methodology. Study design is experimental and it's comparative study. Sample size is 44. Sample techniques is simple sampling techniques. Inclusion criteria is age 18 to 25 years of females, female with weight gain, irregular menstrual period, and dysmenorrhea. Exclusion criteria is married women, PCOS patients who are on pills, and multiparous women. So study tools were match, baseball, dumbbells, TheraBands, training shoes, cycle ergometer, and treadmill. So procedure. All the participants with the clinical diagnosis of polycystic ovarian syndrome, as per the inclusion and exclusion criteria, were requested to participate in the study. Participants were briefed about the study. The intervention and written informed consent was obtained. Before and after study, BMI, numerical pain rating scale was assessed. All the participants were divided into two groups. Please next slide. Yeah. So for Participants who were eligible were 48, but due to some reasons, 4 were excluded. Allocations were given to 44, and each group were divided into 22 participants. Written informed consent form taken. So intervention of group A was warm up for 5 to 10 minutes, aerobic training, which included cycling, treadmill, walking, 20 to 30 minutes, cool down, and total duration of intervention for both the group was 30 to 45 minutes, and for 5 days per week for 12 weeks. So group B intervention was warm up for 5 to 10 minutes, resistance training, which included which was for 30 to 45 minutes, which included upper, lower limb, and core strengthening. Next. Pre-test, during test, and post-test, NPRS and BMI were calculated, and there were no dropouts throughout the study. Yeah. Next. So, result, both BMI of both groups were calculated, and these are the main values of group A and group B. So, according to table, we can see that there is significant changes in BMI in group A. Next slide. Next. Excuse me, ma'am. 1 minute, please. Next slide. Hello. Yeah. This is the intergroup comparison of NPRS of group A and group B. So, next slide. Yeah, this is NPRS comparison of group A and group B. So these are the mean values of NPRS from group A and group B. So from this graph, we can see that there is significant changes in group A. Next slide. Yeah, this is the chart form of that table. Next. So, discussion. In the present study, the effect of aerobic training and resistance training on weight, BMI, pain was conducted to determine the reduction of symptoms among the PCOS. Some researchers such as Jesslyn K. Christian MF found in their study in 2016 that effect of progressive resistance training on lean mass in women without, excuse me, PCOS and its effect, metabolic factors, and concentration of related steroid hormones. There was another research by Edward Caldas which concluded that progressive
Last 1 minute.
Yeah, training improved the cardiorespiratory fitness. Next slide. Next slide.
I have changed it.
I am unable to see it.
Just wait. Okay.
Yeah, next. So, according to this study, the conclusion is that aerobic training is more effective than resistance training to treat patients with polycystic ovarian syndrome. Next slide. Yeah, limitations of this study is we included small sample size, and a specific age group has been targeted. So, future scope of this study is a more large population can be included, and combined effect of aerobic and resistance training can be seen.
Okay.
Yeah. All these are references. Thank you.
Okay. Question answers.
My question is that you have excluded the participants who are taking medications for PCOD, right?
Yeah. Hello.
Hello.
Yes, ma'am.
You have excluded the participants who are taking medications for PCOD?
Yes.
Right? So, don't you think so that it will be ethical issues that you are only taking participants who are not taking medications because you are depriving them from the physiotherapy?
No, ma'am, it's not that we are means we are not going to intervene them, but actually, if they are taking PCOS pills or they are on course, so we will not be able to differentiate whether the result is of the pills or it is of exercise. So, just to study, we have taken this criteria that we will not include the patients who are taking PCOS pills. But when if you are now we are concluded that there is aerobic training effect, so we can give this exercise to them also. But just to differentiate it, whether it is the effect of pills or it is the effect of the exercise, we have excluded them.
If you would have taken participants with medication and if you have included in both the groups, then it would have been better, because for 90 days you are depriving the patient from the medication. So you can take the participants from with medications, even if you have taken that in both the groups, then the bias must have reduced. Okay, but it is a very good attempt, very nice study.
Thank you.
Any question, Dr. Basavaraj?
No question, madam.
Okay. So our next participant is JR05.
This was 02, no? Just now finished.
Yes, yes. 03, ma'am. 03.
03. Okay.
Okay. Now we'll be starting with 05. 05, are you here? Candidate JR05. Okay. Okay, your time starts now.
Good afternoon, everyone. My title is Prevalence of Premenstrual Syndrome in Physiotherapy Students. Premenstrual syndrome introduction. Premenstrual syndrome is a set of distressing physical and psychological symptoms that begins a few days before menstruation and lasts for a few days after. This was first described by Frank and Harney in 1931. Premenstrual dysphoric disorder is a severe form of PMS and recur for at least 2 menstrual cycles. PMDD has been included as a psychiatric disorder in the 5th edition of the Diagnostic and Statistical Manual for the Mental Disorders. Premenstrual syndrome is described by the cyclic way of gathering of physiological or potentially behavioral side effects showing up amid the late luteal period of the menstrual cycle, that is 7 to 14 days prior to menstruation, and as a rule of medicine not long after the onset of menses. PMS can be characterized as an event of gently to seriously troublesome physical and additionally mental side effects intermittent in relationship with the premenstrual period of menstrual cycle. Symptoms of PMS fall into 3 domains: emotional, physical, and behavioral changes that present premenstrually and resolve gradually following the cessation of menstrual cycle. Previous Indian studies have found a 20% of prevalence of PMS in the general population, and among those with PMS, 8% had severe symptoms. In Gujarat, PMS was 18.4 and PMDD was 3.7%. Need of the study. There are many studies have been done on prevalence of premenstrual syndrome in young females, but very less studies have been done on their relation with body weight. Aim to assess the prevalence of premenstrual syndrome in 17 to 23-year-old girls. Objective of the study is to find out the prevalence of premenstrual syndrome in 17 to 23-year-old girl and divide them in mild, moderate, severe, and very severe categories using premenstrual syndrome scale to find out the weight status of 17 to 23 years old girl using BMI and waist hip ratio to find out the association between prevalence of premenstrual syndrome and weight status using body mass index and waist hip ratio. Next. Outcome: premenstrual syndrome scale, body mass index, and waist hip ratio. Methodology: design cross-sectional study, setting physiotherapy college, sampling method, simple random sampling, and sample size 228. Inclusion criteria: 17 to 23 years, marital status, single or willing to participate. Exclusion criteria: married woman, irregular menstrual cycle, current major medical and psychological problem, receiving any hormonal therapy. Data collection tools: premenstrual syndrome scale, stadiometer, Omron digital weighing scale, calculator, measure tape, pen. Procedure: subject fulfilling inclusion criteria were selected, informed consent was taken, and research was explained. Body mass index, waist hip ratio, and premenstrual syndrome scale were taken. Result: descriptive analysis using mean and percentage values to determine the average age of participants along with the total percentage of female with PMS symptoms was done. The age of the 228 students who participated in this study, age group of whom range from 17 to 23 years with mean age of 20 years. In total, 228 participants all reported experiencing various degrees of at least one symptoms of 40 symptoms included in the scale. Result, the most prevalent symptoms were physiological symptoms 33.27%, psychological symptoms 27.18%, and behavioral symptoms 22.38%. 54.39% of participated population was having mild symptoms of PMS, 32.89% of population having moderate, 11.40% of population having severe symptoms, and 1.32% population presented with very severe symptoms of PMS. All the participants were assessed for their waist hip ratio, through which their health risk level was assessed, in which 32.89% of participants were under excellent category, 33.77 participants under good category, 26.70% of participants were under average category, and 6.58% of participants were at risk category. Weight categories of population was assessed using BMI. In that, 27.63% of population was having underweight, 46.93% of population was normal weight, 10.53% of population of overweight, and 14.90% of population was obese. Severity of premenstrual syndrome differs according to BMI range. 15.35% of underweight population presented with mild symptoms, 8.3% having moderate.
1 minute is left.
Next. This is the variation of the symptom severity of PMS according to BMI. According to result, we can state that overweight population has moderate symptoms of PMS. Next. Variation of symptom severity of PMS symptoms with waist hip ratio. Next. Conclusion, the age of the 228 students who participated in the study, age group of 17 to 23 year age with mean age of 20 years. In total, 228 participants all reported experiencing various degrees of at least one symptoms of 40 symptoms included in the scale. The most prevalent symptoms were physiological 33.27%, psychological 27.18%, and behavioral 22.38%.
Okay,
And 50.
time is up.
Thank you.
No question from my side.
What would be the clinical implications of your study?
In those who having severe symptoms, they are given to aerobic exercise and endurance training like walking, brisk walking, jogging, and running.
Okay, but how would be your study significantly a contribution towards the improvement of health?
In if a patient having very severe, in my result, there is no correlation between weight status of in BMI. According to waist hip ratio, there is no correlation between severity of symptoms and related to obese patient or according to very severe waist hip ratio means.
Okay. Okay. Thank you.
Thank you, sir.
Okay, we will move ahead. The next candidate is CBR Junior 06. 06, are you ready?
Yes, ma'am. Am I audible?
Yes, you are.
Okay. So good afternoon, everyone. Today's topic for my presentation is effect of cutaneous manifestation with BMI in PCOD women. Next slide. PCOD, that is polycystic ovarian disease, is a spectral disorder that affects women of reproductive age, predisposing them for high risk of obesity and infertility. leading to disturbance of reproductive, endocrine, and metabolic function. Chances of getting PCOD is mainly due to the adaptation of sedentary lifestyle, lack of physical activity, unhealthy lifestyle, and food habit affecting their quality of life. The hallmark features of PCOD are sudden increase in weight gain, facial hair growth, and acne. Next slide. So, in this COVID pandemic scenario, where sedentary lifestyle was adopted, accompanied with a lack of physical activity and commonly developing an unhealthy lifestyle with unhealthy food habits, due to which there is increase in weight gain associated with cutaneous manifestation, which increases the chances for women developing PCOD. So this is the need for my study to find a correlation of cutaneous manifestation with BMI in PCOD women. The aims and objective is to find out a correlation of cutaneous manifestation with BMI in PCOD women. Next slide. Hypothesis. Alternative hypothesis is the effect of cutaneous manifestation with BMI in PCOD women, whereas null hypothesis gives a question that is there any correlation of cutaneous manifestation with BMI in PCOD women. Next slide. So these are the review of literature supporting my studies. Then materials. Materials used for calculating BMI was measuring tape and weighing machine. And for cutaneous manifestation, we have assessed the physical examination. Then methodology. This was an observational study conducted on a convenient sampling size of 82 college-going women having PCOD. Next slide. General procedure for this study. Firstly, a permission was taken from Institutional Ethical Committee, followed by consent of each woman. After that, women were assessed based on their demographic data, menstrual history, and physical examination, followed by data collection, data analysis, and result. Inclusion criteria was age between 18 to 25 years, having PCOD, college going, and willing for participation. Exclusion criteria was pregnancy, history of trauma, abortion, gastrointestinal infection, and recent history of fever. So from the above study, we can conclude that out of my total sample size, 45% having irregular menses at 3 to 6 months of interval, whereas 35% have regular menses at 30 to 40 days of cycle. Comparison of cutaneous manifestation having in PCOD women having irregular menses, in that the weight gain was in more proportion than pimple and facial hair. When comparing the cutaneous manifestation in PCOD women having regular menses, weight gain was more than pimples and facial hair. So this is the comparison between the cutaneous manifestation in PCOD women having irregular menses and regular menses. The result is p-value that comes out to be less than 0.001, that is statistically significant. Then, when comparing the BMI in PCOD women of irregular menses and regular menses, to be conclude that irregular menses women have the high percentage of gaining increase in BMI. So from the above graphs, we can conclude that there is a correlation of having a cutaneous manifestation like weight gain, facial hair, and acne with BMI in PCOD women. Thank you.
Thank you. Questions?
No question from my side.
No questions from my side as well.
Okay. Now we will move ahead to our next candidate. The candidate is JR07.
Yes, ma'am.
Okay.
Am I audible, ma'am?
Yes, you are.
Okay. A very good afternoon to respected teachers and dear friends. So as we all know that our moms go through the worst pain ever in order to give birth to the best gift ever. So here is my topic: prevalence of musculoskeletal problems in postpartum period up to 6 weeks in women. I wish my study brings a little difference for our real heroes, that is our mothers. So the introduction: a woman's body undergoes many changes during and after pregnancy, which are weight gain, changes in posture and joint and ligament laxity, along with the changes in muscular tendinous strength, which can be painful, which can cause painful conditions which might interfere with the functional daily activities and therefore with their quality of life. The female body changes. The female body changes during the post-pregnancy time frame, returning the distinctive body frameworks to the pre-pregnancy state as quickly as time permits. So as we see, there are various changes occurring during and after pregnancy, and therefore our women should get unique considerations during this period in light of the fact that agonizing conditions may happen that might interfere with the activities of daily living. A study inside the maternity ward showed that 79% of puerperal vaginal delivery ladies and 98% of puerperal cesarean section ladies had utilarian restrictions. Next. Need for the study. To investigate the widespread and to measure the sensitivity of pain in activities of daily livings in postpartum women of vaginal delivery and cesarean section up to 6 weeks. Physical therapy procedures will aim at preventing and managing women's complaints of pain and such functional limitations. Next, please. Aim and objectives. Aim. This examination means to research the broad and to gauge the affectability of the torment in exercises of day-by-day living in post-pregnancy ladies of vaginal delivery and cesarean section up to 6 weeks. My objectives are to determine the prevalence of musculoskeletal problems in postpartum period and to evaluate the quality of life affected due to these musculoskeletal problems in postpartum women. Material and methodology. It is an observational study conducted in Nagpur city with the sample size of 90 postpartum women, and a questionnaire was sent via web to these women. Next slide. An informed consent was obtained and all the ethical aspects were respected. Responses to other than of these 90 women were excluded who had the history of musculoskeletal dysfunction even before the pregnancy. This questionnaire records the prevalence of musculoskeletal problems in terms of musculoskeletal symptoms, that is ache, pain, or discomfort. A questionnaire to identify the musculoskeletal problems was developed consisting of 25 questions. Next. It was validated by experts. The understandability of the questionnaire was tested by administering it to 10 postpartum women in maternal clinics, and after the correction, the final questionnaire was prepared. Then this questionnaire was sent to women up to 6 weeks of delivery. Questions were based on daily activities and tasks performed, which evaluated physical discomforts and their difficulty in performing functional activities. The data was recorded on Excel word sheet and was analyzed in statistical software, that is STAT, using GraphPad software. Next. Results. In data analysis, we can see these 3 graphical representations about the activities done by the mothers. In first, we see that out of the 90, 54.8%, that is 49 women, face difficulties in sleeping. In the second graph, we see 58.8, that is 65 women out of 90 face difficulties in changing positions, which were recognized under the movement problems. And in the third, we see that 58.4, that is 64 women out of 90, had difficulties in breastfeeding while taking care of the baby. Next slide. Next slide. In this chart, we analyze the site of pain and discomfort. The highest levels of symptoms were found at the low back region, that is 86 women, and for the ankle pain, it was 50 women. Next, please. These charts represent about the type of delivery where 62 women had undergone C-section, and in the next one, we see the mean age is 29 years. Next slide. In this, we see about the woman who took physiotherapy post-pregnancy, and we come across that 73 women did not seek physiotherapy for their symptoms. And on the other side, we see the women who went for antenatal classes, postnatal classes, both the classes, and no classes at all.
Last 1 minute.
Where we find that 55% of the women didn't go for the classes at all. Next slide. Conclusion. In this study, we concluded that the highest level of symptoms were found at the low back, that is 95.5%, and ankle 55.5%. The highest number of complaints were associated with the movement activities and cesarean section postpartum. Next slide. This study indicates that the puerperal cesarean woman had more discomfort, while puerperal vaginal delivery women did not feel pain when performing the same functional activities. There was a study of postpartum women having a vaginal delivery indicated that pain after the perineal trauma restricted the woman when sitting down, walking, sleeping, caring, and caring of the newborn. Next slide. These are the references. Thank you.
Question answers.
In your study, your title mentions about musculoskeletal problems, but I feel that you have taken a lot of other data also in your study. So can you justify that?
Yes, ma'am. It was overall the questionnaire was prepared related to the sensitivity of the pain as well while grading it, and also the site of pain as well as the activities involved in it.
Because in your study, you have also evaluated whether they have taken physiotherapy or not. Then
Yes.
what were the difficulties in self-care activities and lot of other things also. So I felt that only the title is not going with the data that you have collected. That's it. Otherwise, a good attempt.
Thank you, ma'am.
So, how would your study be useful in planning a treatment?
We can encourage the women for the antenatal and postnatal classes where we can give them suggestions related to the pain and symptoms they'll be having and prepare there for their postpartum care.
Can these be used? What would be the other uses you think as per your this study results? So, what would be the findings? How would they be beneficial to the pregnant ladies?
The functional limitations can be prevented while encouraging them and while telling them the proper ergonomics related to the baby positioning and while pregnancy, while sitting, all the ergonomics related things. We can assure that they are following that properly and therefore they won't be having any functional limitations.
Okay.
Which would affect their quality of life.
Okay.
Thank you.
Thank you.
Move ahead with CBR 11 now. Are you there? CBR 11.
Yes, ma'am.
Okay, we will be starting your time starts now.
Good afternoon, everyone. The title for my paper presentation is Validity and Reliability of Gujarati Translation of Lawton Brody Instrumental Activities of Daily Living. Next slide, please. Introduction. The activities of daily living is a term used to collectively describe fundamental skills that are required to independently care for oneself, such as eating, bathing, and mobility. The activities of daily living are classified into two: basic activities of daily living and instrumental activities of daily living. In elderly population, that is between the age of 65 to 70, the activities of daily living are majorly affected due to bodily changes and also due to sedentary lifestyle. Activities of daily living is used as an indicator of a person's function status. The inability to perform activities of daily living results in dependency of other individuals and or mechanical devices. The inability to accomplish essential activities of daily living may lead to unsafe conditions and poor quality of life. An ADL assessment helps to determine whether or not a patient may require further rehabilitation or assistance at home, or if a skilled nursing or long-term care facility would be a safer environment for the patient. Next slide. The Lawton Instrumental Activity of Daily Living Scale is used to evaluate independent living skills, which was developed by Lawton and Brody in 1969. The instrument is most useful for identifying how a person is functioning at a present time and so to identify improvement or deterioration over time. The scale measures 8 domains of function, including food preparation, housekeeping, laundry. Individuals are scored according to the highest level of functioning in that category. Next slide. A summary score ranges from 0, that is low functional dependent, to 8, high functional independent. The scale is easy to administer assessment instrument that provides self-reported information about functional skills necessary to live in the community. Specific deficit identified can assist nurses and other disciplines in planning for the safe discharge. The limitation of the scale is that it is self-administered test rather than the actual demonstration of the functional task. This may lead to either overestimation or underestimation of the ability to perform the activity. Next slide. The need of the study, Lawton instrumental activity of daily living is a scale that provides self-reported information about the functional skills necessary to live in the community. Due to lack of use of English language in the Gujarat state, it is not possible for the therapist to use the scale as it is available in English language only and has to be filled by the patient him or herself, that is, it is self-administered. So the need of the study is to know the validity and reliability of Gujarati translation of Lawton Prudy instrumental activities of daily living. Next slide, please. Aim of the study is to know the validity and reliability of the Gujarati translation of Lawton Prudy instrumental activity of daily living. Objective is to find out face validity of Gujarati translation of Lawton Prudy instrumental activity of daily living. And second is to find out retest reliability of Gujarati translation of Lawton Prudy instrumental activities of daily living. Next slide. So the hypothesis could be, first, null hypothesis that the scale Gujarati translation of the Lawton Prudy instrumental activity of daily living is not valid and reliable. And the alternate hypothesis was that the Gujarati translation of the Lawton Prudy instrumental activity of daily living was valid and reliable. Methodology, the source of the data was the geriatric population. Type of this study is observational study. Sample size is 50 and sampling technique was convenient sampling. To ensure face validity, Gujarati version using group census method was used by 2 people with experience of 5 years. The experts were a Gujarati professor and one lay person who knew Gujarati language well. Both persons were contacted personally for phase 1 validity and changes were made accordingly. Next slide. To measure retest reliability, 50 elderly individuals between 50 to 70 years were randomly selected and knowledge about the purpose of the test is given. The scale was given to the same individual at 2 different times and the scores were compared. Next slide. Inclusion criteria, age between 50 to 70 years, because the Lawton instrumental activity of daily living, they use the specific word of elderly. That is why the inclusion is between 50 to 70. Participants who are willing to participate and stable patient means they're not dependent on like oxygen for their living. Exclusion criteria, participate having Alzheimer's, because if the patient has memory loss, it would be difficult. Patient with visual problem, as the patient has to self-administer. Hearing problem, if the patient was having, then they were not able to hear what the commands, and who are not mentally stable. Next slide. Outcome measure was the Gujarati translation of
1 minute is left.
Lawton Prudy instrumental activity. Next. So the procedure next. Next, to find out face validity, forward translation. Ma'am, please, the previous slide. Thank you. Translation first was to the Gujarati professor and T1, and T2 was to the layman person. Then the synthesis of T1 and T2 were done, and the best scale was then received. Then backward translation again to the English language was done. Expert committee review, in which the person was expert in both English and Gujarati was selected, and the final version of the scale was done. Ma'am, next. For retest, 50 individuals were given the same scale in the interval of 24 hours, and the interclass correlation coefficient was used. Next. SPSS version 23 was used with the level of significance of 5, and interclass correlation coefficient was
Your
used
time
to
is up.
test. Okay, thank you.
No question from my side.
Okay. Just I want to know what is the conclusion ultimately.
Sir, the result concluded that it has a good validity because in phase 1 it was valid with 85% of the things which was in the initial scale were not changed, and it had a good reliability of 0.95%, and also correlation value was there. That is, it has a correlation of 0.011. So it has a good reliability. The scale has good reliability and validity as well. Okay, thank you.
Okay, our next candidate is candidate number JR 13. JR 13, are you ready?
Yes, ma'am.
The time starts now.
Diastasis, my title is Diastasis recti abdominis muscle with fitness. It is a case report. Now we'll go to the introduction. Diastasis recti abdominis is a condition which is defined as a separation between the rectus abdominis and the linea alba, which leads to the weakness in the abdominal muscle. Following childbirth, most women develop some extent of the muscle separation in the postpartum period. However, if the diastasis recti abdominis in the postpartum period remains severe, it should be corrected to prevent the current abdominal hernia, strangulation, or the incarceration. Then determining a DRA is done using a criteria or separation of more than 2 centimeter at one or the more points of the linea alba, including the level of the umbilicus or 4.5 centimeter above or below it, or a visible midline bulge with the exertion. Rectus abdominis separation is more predominant in the supraumbilical region and is linked to the mother's age as well as the body mass index. Now, next slide. Yeah. Methodology. The female came with the complaints of the pain in the abdomen and the difficulty in the reducing weight. She feels fullness in the stomach and occasionally low back ache. The female diagnosis with the diastasis recti with flabby stomach and the weight gain was included in the study. Then she was underwent the lower abdomen cesarean section in 2015. Her weight before the pregnancy was 54 kgs. During the pregnancy was 83 kgs. Then after 15 days of the pregnancy, she was 64 kgs. Then because of her leg due to the rest and the busy schedule, she was not able to give attention to her health after the 3 months. Next slide, please. Then she felt increase in the weight gain further and she was not able to reduce it. And after the span of the 6 months, she felt fullness of the stomach, which did not reduce after the delivery. She visited doctor for the same, where she was told about the diastasis recti and advised to correct it, but did not do exercises regularly because of a busy schedule. Then the treatment protocol was given her was 8 weeks. Then the protocol was as follows: 5 minutes warm up, upper limb and the lower limb stretching of major muscles, 3 repetitions, 30-second hold. Then aerobic training included step up and the step down and the modified mountain climber in the standing. Next slide. Yeah. Hip abduction in standing. Strengthening includes static back, static abdomen, head lift with the DRA approximation, core activation with the pelvic bridging, bicycle crunch exercise, and the plank hold. 5 minutes of the cool down period, thoracic expansion, and the pursed lip breathing were given. Total of the 30 to 45-minute treatment was given for 5 days per week for 8 weeks. Then this protocol was given till 8 week, progressed with the increase in the repetition and increase in the holding time. Now, outcome measure were taken: oscillatory low back pain disability index, body mass index, digital examination of diastasis recti, cardiorespiratory fitness by the 6-minute walk test, endurance using the partial collapse and the modified boxer. Now, doing the plank and crunches. Now, result of pre-values and the post-values. BMI, it was before 8 week 30.6 obese. Now BMI, it is 29.2, overweight, 3 kg of weight loss is there. Now DRA examination, which was done by the digital examination, where the patient is lying supine, knees are bent, and we are placing on 2 or 3 fingers horizontally.
Then at umbilicus, it was 3 centimeter. Below umbilicus is what's 3.5 centimeter. After 8 weeks, it has shown a reduction of at umbilicus 2.5 centimeter and below umbilicus 2.5 centimeter. Now VO2 max before was average. Now VO2 max is good. Then pre values of endurance, which we have done, is fair. Now it is good. Then modified box scale was 2, which is slight. Now it is 1, which is very slight. Then oscillatory low back pain disability index, at the starting it was at 20% of the pain, when now she has only 6% of the pain. Now conclusions taken into the account, the result of this current report showed that diastasis recti improvements after the following the above given exercise protocol. This protocol can be used for the future research on the diastasis recti correction. And these are the references which I have taken. Thank you.
Any questions?
So what would be the recommendation for the overall this diastasis recti group of patients?
We can give means from my study, I can say that after the certain period, after the postpartum, we should start it with the exercise to the mother, so that it can be improved early. As my patient came to me after the 5 years, so it takes time to do it. So I will recommend that postpartumly after cesarean delivery, at least after 6 to 8 weeks, we can start the exercises.
No question from my side.
Thank you. Thank you. We'll now move ahead with CBR 14. CBR 14, are you there?
Yes, ma'am.
Okay. Your time starts now.
Good afternoon, everyone. So topic of my study is matrix rhythm therapy on the primary dysmenorrhea. Moving to introduction. Menstruation is purely a physiological process preparing
Can you
the
speak
female
little
body.
louder? Excuse me.
Okay, ma'am. Yes, ma'am. Menstruation is purely a physiological process preparing the female body for reproduction. It is a monthly shedding of female's uterine lining, which lasts about 3 to 5 days on an average and contains blood and the tissues that exits her body through the cervix and the vagina. Most female experience certain degree of pain and distress during the menstruation period, which is classified as dysmenorrhea. Dysmenorrhea refers to the symptoms of painful menstruation. It is a cramping or painful sensations, usually in the lower abdomen, and it often occurs with the other symptoms like back pain, headache, nausea, vomiting, fatigue, and diarrhea, and all occurring just before or during the menstruation. Broadly, it is divided into primary and the secondary dysmenorrhea. Primary dysmenorrhea, it is a menstrual pain that is not related to any kind of pelvic pathology, and it is observed only in the ovulatory cycles and frequently beginning during the adolescence. While secondary dysmenorrhea, it is defined as menstrual pain that is generally related to some kind of gynecological disorders. According to a prevalence, the prevalence of primary dysmenorrhea are very common complaint in the late adolescents and the young women. It affects 40 to 95% of the menstruating women, and the prevalence of dysmenorrhea is 77.6%. And the pain usually lasts for about 8 to 72 hours during the menstrual cycle. Next slide, please. Coming to the matrix rhythm therapy, so it was developed by Dr. UG Randall. According to Dr. UG Randall research, the cells in the human body are always oscillating in a frequency ranging between 8 to 12 hertz, provided they are surrounded by a healthy extracellular matrix. The matrix rhythm therapy pulsation gently and harmoniously induces the cells to regain their own oscillatory frequency, which is 8 to 12 hertz, and which results in the improved supply of oxygenated blood and the nutrition through the extracellular matrix. Elimination of waste products as acids and gases takes place. Improved active cellular transportation results in the production of energy in the form of ATP. Hence, it will help in healing and regeneration of the cells, and specific effects of MRTs are also there. Next slide, please. This is the picture of the matrix rhythm therapy. Need of the study is, as matrix rhythm therapy is a new electrotherapy modality, it enables efficient treatment of the medical condition connected with disturbance in the microcirculation. There is no side effect of the matrix rhythm therapy. No studies have been conducted to prove the effectiveness of matrix rhythm therapy on the dysmenorrhea, and many women of these age groups are taking painkillers for the pain relief, and as this machine work on the cellular level without any side effects, therefore the study intends to explore the effectiveness of matrix rhythm therapy on the dysmenorrhea. Next slide, please. Aim of the study is to find the effect of the matrix rhythm therapy on the pain relief in the dysmenorrhea. Coming to the procedure, participants with primary dysmenorrhea whose VAS score was more than 5.
Can you just
and
hold your mic nearby?
Yes, sir. Am I audible now?
Yes.
Okay. So participants with primary dysmenorrhea whose pain score was more than 5 on the visual analog scale and who were taking painkillers for the pain relief were included in the study. Sample size was 30 by the convenient sampling method. The participants who were willing to participate and whose VAS score was more than 5. Pre-pain assessment values was taken using VAS, and then matrix rhythm therapy was given for 30 to 45 minutes over the whole spine, that is sympathetic and the parasympathetic region, during the first 3 days of the menstrual cycle for 3 months. And post intervention pain assessment was taken by the VAS after each session for 3 months, and then statistical analysis was done. So these are the pictures showing where the matrix therapy was given. Outcome measure was visual analog scale. It is a 10 centimeter long scale, and the person has to mark where she is suffering, she is having pain on a score of 0 to 10. 0 means no pain and 10 means the maximum pain. Coming to the result and conclusion, by using pair t-test for the statistical analysis, the samples were normally distributed, and the mean difference of VAS in each cycles were, for the first cycle it was 8.18 to 7.14. Second cycle it was 8.06 to 7.53. For the third cycle it was 7.51 to 7.01.
Last 1 minute.
Yes, these are the graphs which are showing the difference in the VAS score from like pre-intervention to post-intervention. This is a graph for first month. Next slide. This is the graph for second month. Next slide, please. This is a graph for third month. Okay, so conclusion of the study is thus the matrix rhythm therapy shows improvement in the pain relief in primary dysmenorrhea and reduces the discomfort and hence decreases the absenteeism from the workplace. Thank you.
What are the precautions that you need to take while giving this matrix rhythm therapy in dysmenorrhea patients?
Okay, ma'am, there should not be any open wounds, or if the person is hypersensitive, because the treatment will be given over the whole spine, and if the person is not allergic to the like we have to use that tulcrum powder for that.
Hello. Hello.
Hello.
Yes.
Hello, am I audible, sir?
Yes. Yes. So, what are the financial implications? Is there a major difference in the cost factor when it comes to other electrotherapy modalities?
Yes, sir. Sir, we can use other electrical modalities like TENS, we can use, or hot packs, which are financially very much feasible. But those machines are working on a temporary basis, like they will block our pain receptors and then pain gate mechanism. But this matrix rhythm therapy, it works physiologically. The cells in our body, they oscillate in a range between 8 to 12 hertz. and this machine also vibrates on the same frequency, so it will help for the permanent solution, like over the period of time the intensity of pain will get reduced.
Okay, any research supporting this evidence, like that it helps in a permanent relief rather than the temporary, like follow up after 6 months, 1 year, 2 years?
So there are several studies which are suggesting, like even in frozen shoulder they have given, plantar fasciitis they have given, so the pain reduction is there, and it also helps in improving the quality of life, and the range of motion also increases by because of this.
Okay.
Shall we move ahead?
Yes, madam.
Thank you, sir.
So
Thank you,
coming
ma'am.
to thank you. Coming to the last presentation for today, CBR 16. Are you here, CBR 16?
Yes, ma'am.
Okay, so we are sharing your PPT. Your time starts now.
Good afternoon, everyone. I would like to take this opportunity to talk about the effectiveness of moderate intensity exercise in women with PCOD. Next slide, ma'am. Polycystic ovarian disease, also known as polycystic ovarian syndrome, is a very common condition affecting 5% to 10% of women in the age group 12 to 45 years. One of the most prevalent disorder among women with reproductive age is PCOD. Though the etiology is unknown, it can be diagnosed on the basis of cardinal characteristics. The symptoms include menstrual irregularity, excess hair growth, acne, and obesity. Next slide, please. The moderate intensity activities are those that get you moving fast enough or strenuously enough to burn off 3 to 6 times as much energy per minute as you do when you are sitting quietly. Some of the examples of moderate intensity exercises are walking, cycling, gardening, dancing, housework, walking pets, playing with children, etc. Next slide, please. Why I failed to study on benefits of moderate intensity exercise only. This is because PCOD is a sedimentary lifestyle disease that is due to the stress, lack of exercise, not eating right, and unhealthy sleep pattern. And due to COVID-19 pandemic, we all know there is provoke of physical inactivity and improper diet. When lockdown began, there was no place to do other forms of activities like high intensity exercises and etc. So many people switched to moderate intensity exercises. This is why I failed to do this study. Next slide. I aim to find out the effectiveness of exercise in women with PCOD, and my objective was the same. Next slide, please. And these are the some of the review of literatures, and my hypothesis was, is there any effect of moderate intensity exercise in women with PCOD? Next slide, please. The material and methodology. This was an observational study, and it was carried out on 51 women of PCOD. After recording socio-demographic and menstrual history and medical history, questionnaire was introduced to the woman about exercise session. Convenient sampling was done, and all were students. In inclusion criteria, the age were 16 to 25 years, all were the women with PCOD and willing for participation. The women who were pregnant, having cardiovascular system condition, history of trauma, renal condition, GIT infection were excluded. The outcome measures was the effectiveness to see the effectiveness of moderate intensity exercise on menstrual cycle. Next slide. This is the procedure by which I have gone for this research. First, I took the permission from the institutional ethical committee. Then consent was taken. Then PCOD women were introduced with the questionnaire, And the questionnaire includes socio-demographic data, menstrual data, and their medical history, and where they're doing moderate intensity exercises or not, which type of moderate intensity exercise they are doing. And this data was collected, then data analysis was done, and result was uh, ma'am, slide. Huh. Out of 51 women, next slide. Out of 51 women suffering from PCOD, 18 are on medication and remaining 33 are not taking any type of treatment. All sample size taken in the study were doing moderate intensity exercises. Those doing irregular exercises, that is 63.3% women having regular menstrual cycle, and whereas 36.7 percentage are still irregular. Ma'am, next slide. So this is the discussion of the research. An observational study was carried out on 51 women of PCOD, and all the 51 women were having irregular menstrual cycle. Next slide, please. Out of 51 women suffering from PCOD, 18 are on medication and also doing exercises, and remaining 33 are not taking any type of treatment. They are only dependent on moderate intensity exercises.
Last 1 minute.
Ma'am, next slide. These are the type of moderate exercise done by the participant. 13 participants were doing cycling, 12 walking, and 8 are dancing and housework. Next slide, please. On doing regular exercise, 63.3% women are having regular menstrual cycle, whereas 36.7 are still irregular. Ma'am, next slide. So I conclude this research on moderate intensity exercise helps the PCOD women to regularize their menstrual cycle. Thank you.
Thank you. Question answers.
How the exercises can be made more lively and joyful for the participants?
So this exercise can be done at the home itself, so they can enjoy properly. They can go for walking in the parks also, and the cycling many parks are giving cycling also.
Okay.
Yes.
Thank you.
Thank you, sir.
Dipali ma'am, any questions here? Dipali madam, any question here? Okay, so here we are coming to an end of today's scientific paper presentation in CBR category. Participant number 4 and participant number 15 have not joined.
Yes. Okay.
So coming to the end of scientific paper presentations in CBR category, I would like to conclude this session. First of all, I request both the judges to kindly hand over the score sheets via WhatsApp.
Yes.
And results of the session will be declared in the validatory function today itself. I thank you both the judges for their valuable time in judging this paper presentation. Kindly accept our virtual trophies. Piyush, can you please hand over the virtual trophies to our judges? Thank you both of you. I just request both the judges to kindly sign on both the score sheets and then send it to us.
Yes. Just I would like to add few words.
Yes, sir, please.
Yes, there have been good presentations throughout this session and a good activity conducted by the college. And yesterday also I attended Arun Maya sir's some part session I could attend, and even
Thank you, sir.
Yeah, it was a very good elaborative. Kale sir spoke very well about the council and its role, how. So it is a good session, good efforts by the entire team. Thank you for giving us the opportunity on being the judge panel. Thank you.
Thank you for your kind words, sir. Thank you so much.
I would like to say thanks to Varsha Kulkarni ma'am and her whole team. And I know that in Pune, the cases are also increasing. So among all this pandemic situation, you could gather good participants, and even I should appreciate that the scientific session has done in very professional manner. So
Thank
I
you,
feel
ma'am.
that we can even start a consultancy how to conduct conferences. Seriously, because the privacy and everything, all the things you have taken care. Because some of the conferences I have seen that the video was also on when the speakers were doing the presentation. So I know that it is not possible with the help of only one person. That I want to congratulate the entire team of Rehab-e-con 2020.
Thank you, ma'am.
So
Since
much.
you have appreciated us so much, I would like to just highlight one point. For all these things, I thank our digital event manager,
Yeah.
DigiShield, Mr. Piyush and Mr. Dipen, Mr. Omkar are online. Thank you so much for all your help. You have the feedback itself here. Thank you.
Thank you.
See you all in cardiorespiratory paper presentations here onwards. We have a 10 minutes break here. You all can stay online for 10 minutes. We will be beginning with cardiorespiratory paper presentations. Thank you. Thank you once
Thank
again.
you.
Hello. Am I audible? Very good afternoon to all. I'm Dr. Virendra Mishra, Professor and HOD, Cardio Department of LSF College of Physiology and Organizing Secretary of the Rehab-e-con 2021. Welcome you all for the scientific session for the cardiorespiratory department. I request our both the judges to please turn on the videos so that participants can know about them. It's my great pleasure to introduce our first judge, Dr. Shilpa Parab ma'am. Madam had completed her Master of Physiotherapy in Cardiovascular and Respiratory Physiotherapy from PT School and Center Government Medical College, Nagpur. Master of Business Administration MBA Executive from Symbiosis Institute Management Studies from Symbiosis International University, Pune. Madam had a total teaching experience of 23 years and Madam presently working as a principal and professor at Chaitanya Medical Foundation's College of Physiotherapy, Chinchwad, Pune since October 2005. Madam's work profile is as Madam is a full-time professor and HOD of Department of Cardiovascular and Respiratory at CMF College of Physiotherapy. Madam had published 8 research papers in national and international journals. Madam is a postgraduate guide since 2007 of Maharashtra Institute of Health Sciences, as well as approved examiner and paper setter of Pravara Institute College of Physiotherapy, Gujarat University, D.Y. Patil University, Navi Mumbai. Madam is a Board of Studies member at MGM Institute, University, Mumbai. Madam had guided many undergraduate and postgraduate students for research paper presented at Avishkar Scientifica, as well as various national conferences. Madam was a chairperson for scientific session of Scientifica research conference organized for the UG and PG student of physiotherapy. Madam had received a receipt of Teachers Gratitude Award conferred by the Rotary International PCMC in September 2018. Also, Madam had received the Significant Achievement Award conferred by the Wanless Physiotherapy College and Bharati Vidyapit Medical College, Miraj, in February 2020. Madam's special area of interest is in creating awareness about the effectiveness of cardiopulmonary physical therapy as an adjunct to the medicines. Also, in improving quality of life of cardiopulmonary patients by innovative and easy to administer physical therapy intervention. We welcome you, ma'am, for the session. And now I hand over to the Dr. Pallavi.
Good afternoon, ma'am.
Good afternoon. Thank you.
Now, I feel honored to introduce our second judge for today's paper presentation, Dr. Gauri Afle, ma'am. Ma'am, can you please start your video? Gauri,
Yes,
ma'am?
I have started. I have started.
Okay, ma'am. I would like to introduce to you all Dr. Gauri Afle, ma'am. Ma'am is a professor in cardiovascular and respiratory sciences in PES Modern College of Physiotherapy, Pune. She has more than 11 years of teaching experience and clinical experience as well. Ma'am has worked as official physiotherapist for Indian table tennis team for Indian Open ITTF Pro Tour in 2009. In her professional career, ma'am has kept herself updated by attending various workshops and CMEs. Ma'am has many publications as well as books under her name. We are blessed to have you, ma'am, as a judge for today's paper presentation. Thank you,
so
ma'am.
much.
Now we will start with the presentation. Before that, I would like to give a few instructions to all the presenters. Kindly listen to it carefully. Please unmute yourself, all the presenters. When your turn comes, we will call out and then you can unmute yourself. In the remaining time, please keep yourself mute. Please do not reveal your identity. You have to use the code given to you as your name. Please abide by the timings. The time given is 8 minutes. We will give you a timing call in between to tell you about the time. As soon as your PPT is displayed, your time will start. If you wish to continue your PPT beyond the given time, then the question answer session will not be held. I hope all the contestants are clear with the instructions. I wish them all the best with the presentation. We will start with the senior category first. SR1, are you ready? Please unmute yourself.
Am I audible?
Yes, ma'am. Yes.
Good afternoon, one and all. My topic of presentation on this scientific platform is surface electromyography of inspiratory muscles during maximal and submaximal loading in COPD patients, a cross-sectional observational study. Next. A review report on COPD in last 30 years revealed in India almost 1.9% to 9% of prevalence account for an estimated burden of about 100 million individuals in India. The peripheral limitation of airway causes air trapping during expiration, progressively leading to hyperinflation. The inspiratory muscles face an increased elastic load because of reduced dynamic load. In severe airflow limitation, respiratory muscle capacity is reduced by lung hyperinflation, which is basically caused by two mechanisms. One is because of static hyperinflation and the other one is because of dynamic. Static is due to loss of lung elastic recoil and dynamic is because of incomplete lung emptying, which results in air trapping. Primary muscle like diaphragm and accessory muscles, their functions are profoundly affected by COPD because of the effort increase in the act of breathing and muscular capacity decreases to overcome ventilation load. Next. So a research question for my study is what will be the inspiratory muscle surface EMG activity during loading in COPD patients? So need of the study is there is significant reduction in muscle strength and endurance of respiratory muscles, which is characterized by loss of muscle mass and cross-sectional area. Abnormal lung and airway mechanics are likely to impair pressure transmissions along the airways during brief dynamic maneuvers. Hence, it becomes necessary to evaluate the activity of inspiratory muscles while performing muscle loading maneuvers. So this study is, previous one please. So this study is basically undertaken to assess primary and accessory muscle activity during maximal submaximal loading, which will help us to understand the neurophysiological working pattern of inspiratory muscles during loading. Next. Aim of the study is to study the surface electromyography activity of inspiratory muscles during maximal and submaximal loading in COPD patients. Next. Objectives of the study are first to assess inspiratory muscle activity by surface electromyography at rest during maximal and submaximal loading in COPD. Next one is to compare between these two muscles between maximal and submaximal loading. And the third objective of the study is to find correlation of inspiratory muscles surface EMG with SNP, that is sniff nasal inspiratory pressure in COPD patients. Next. Null hypothesis, there is no difference in inspiratory muscle surface EMG during submaximal and maximal loading in COPD patients. There is no correlation between inspiratory muscle surface EMG with SNP in COPD patients. Next. Methodology, the study design is cross-sectional observational study. The study setting is IPD and OPD of pulmonary medicine setup of General Medical Hospital. The patients, both male and female of COPD between 45 to 70 years were recruited as per inclusion criteria, moderate and severe COPD, followed by GOLD guidelines. Excluded patients were with upper respiratory tract infection with nasal discharge, neurological or musculoskeletal diseases, any other pulmonary disease, or any recent major surgeries. Next. After getting the permission from the ethical permission from institutional committee, the total 30 subjects were recruited by purposive sampling technique. Outcome measures used for this study was amplitude in millivolts and ultimately root mean square value of EMG and SNP, that is nasal inspiratory pressures in centimeters of water. Instruments used for the current study was PowerLab 2060 dual bioamp stimulator, which had an intra-class correlation of 0.95 to 0.99. The another instrument used for SNP was micro RPM. The ICC range was 0.82 to 0.90 with accuracy of plus minus 3 centimeters of water. Threshold muscle trainer was used with the accuracy of plus minus 2 centimeters of water and repeatability of plus minus 1 centimeter of water. After recruiting the subjects, initially a pilot study was being performed on first 5 subjects to get familiarized with EMG technique. Then inspiratory muscles, 2 muscles, diaphragm and sternocleidomastoid, they were loaded with TMT submaximally and SNP maximally. Surface electromyography of 2 muscles, diaphragm and sternocleidomastoid, was recorded in upright sitting position with the help of 5 electrodes. Out of that, 1 was ground electrode placed on the sternum. For diaphragm, the electrodes were placed on 7th and 8th right intercostal space, and for sternocleidomastoid, it was on the distal part of the muscle. Data coding was done in Excel sheet. Next. Statistical analysis, after taking the detailed demographic data, this table represents value of mean standard deviation of diaphragm and sternocleidomastoid at rest, submaximal and maximal loading. Next. This table basically represents analysis of mean differences between diaphragm and sternocleidomastoid at rest as well as loading, that is submaximal and maximal loading. With the help of paired t-test, it revealed that there was no significant difference between the two muscles at various levels of loading. Next. Correlation coefficients, SNP had a significant moderate correlation and with diaphragmatic muscle during maximal loading, and strong correlation was found for sternocleidomastoid muscle for maximal loading, which was almost significant at p equals to 0.01. Next. Discussion. Hawks et al. Studied the response of acute loading of respiratory muscles in healthy people. There was significant increase in the root mean square value of respiratory muscles during loading. The reason for increase in the activity could be due to adjustment in intramuscular coordination. It can also reflect altered central drive during increased co-contraction of accessory muscles with diaphragmatic involvement. Next. Pulmonary hyperinflation leads to alteration of chest wall shape and change in the geometry, because of which the muscles are subjected to chronic mechanical loading, thereby inducing muscle dysfunction. Next. The activity of the diaphragm and accessory muscles shows 30% increase whenever they are loaded.
Last 1 minute.
Yes, and the previous study concluded deliberate effort. There is heterogeneous muscle recruitment as well, along with primary muscles of respiration. Your accessory muscles also becomes very active. However, one can conclude SNP has strong correlation with sternocleidomastoid. Next, please. This study suggests there is increase in inspiratory muscle activity as the muscle is loaded submaximal and maximally. No difference in the activity of diaphragm and sternocleidomastoid was noted, and positive correlation was noted with both the muscles. Next. Limitations: only 2 inspiratory muscles were taken. Obese, overweight patients were not included. Next. There is understanding of activation and recruitment pattern of respiratory muscles during rest and various stages of loading. So training or treatment protocol can be planned accordingly, which can further bring about improvement in functional capacity. Next. Future scope: the study can be undertaken including control group for better comparison. Even the study design will improve because of inclusion of control group. Muscles of inspiration other than diaphragm and sternocleido also can be assessed, and instead of surface EMG, fine needle electrodes will give maximum level of accuracy in the measurement of EMG. Next. Thank you.
Tejas, any question?
Yeah. I want to know what was your basic purpose? Was it the establishing the correlation or to find out how the muscle is recruited at submaximal and maximal load?
Yes, thank you for the question, ma'am. The primary objective of my study was basically to study the neurophysiological behavior of respiratory, inspiratory muscles during loading. And my secondary objective of the study was to see the correlation between SNP and then with muscles.
And how did you decide the submaximal and the maximal load?
Yes, actually, it is the literature has well said that with the help of micro RPM, whenever we are performing SNP maneuver, it gives maximal level of loading. So we had performed SNP maneuver, the measurements were recorded, and 60% of that measurement was used as per the guidelines for submaximal loading of inspiratory muscles.
Thank you. Thank you for your responses.
Thank you.
SR02, you are ready?
Sir, I wanted to ask one question.
Yes, please, ma'am.
Yes, I'm there. Yeah.
Ma'am, you said that there is neurophysiological function associated with this. And can it be used in other muscular dysfunctions of the respiratory muscles? Because the clinical implication says that.
Yes, definitely. Whatever literature review is being done, it is said that the EMG is very useful not only in respiratory conditions, but in any other musculoskeletal conditions.
Ma'am, I am talking about respiratory conditions only. That in case of any other condition where there is muscular dysfunction of
As
the
far as
respiratory.
yes, I think I would like to answer this question as far as literature review was done, we had not come across any other diseased respiratory condition which had used this surface EMG. But if we have to justify ourselves, we can always say that any disease, any chronic disease which can have the affection of muscles in the form of reduction in strength and endurance, surface EMG might be useful. I think further studies can be done on the given topic.
Okay, ma'am. Thank you.
Thank you.
Shall we move ahead with the next presenter?
Hello.
SR02, you are ready?
Yes. Sir, actually there is a lot of leak.
Coming from your side. Please use headphones. Please use headphones.
Hello.
Its echo is coming.
Hello.
Ah, if any other presenter is there beside you, please ask them to stay a little bit away. Hello.
ऐकूच नाही येत आहे.
Hello.
Then through phones, please keep your laptops aside. And if you have logged into laptops, keep your phones aside so that you will not hear the issue.
If anyone else is ready, we can go with that. Till that point, we'll correct the technical issue, Virendra. If any other
Yes.
candidate is ready. That is
SR03, you are ready? SR03. SR03, you are there?
Sir, is it fine now?
Yes, yes.
Yeah, it's fine.
Sir, is it
So,
fine now? Yeah, okay, I'm ready.
SR02.
Yes, sir.
And your time starts now.
Okay. Good afternoon, everyone. I'm going to present topic effect of coronavirus pandemic on physiotherapists working in private physiotherapy clinics. Next, please. So since the first report of coronavirus disease 2019, that is COVID-19, world has first case was taken in Wuhan, just a minute, Hubei province of China. On December 31st, 2019, the global community has experienced devastating consequences. The WHO in March 2020 declared the COVID-19 outbreaks a pandemic. Next slide, please. So the development was followed by several national and international orders to control the spread of virus, such as regular hand washing, social distancing, use of face masks, and a lockdown was imposed to control the spread of virus. So during this lockdown phase of pandemic, many professionals have had to go through difficult times financially, emotionally, and professionally. So one of the many professions included physiotherapy profession. Next, please. So problems in physiotherapists working in private clinic included income and employment challenges, lack of physician reference, direct access to patients, reduced practice hours, and personal and family safety at risk. Next, please. So the present study was aimed to study the effect of coronavirus pandemic on physiotherapists working in private clinics. Next, please. So this was an observational study containing 30 participants, and purposive sampling method was used, and it was carried out in an urban area, and study duration was for 6 months. Next, please. So participants included were physiotherapists working solely in private clinics. Both male and female were included. And physiotherapists working in academics, hospital setups, or anywhere else were excluded from the study. Next, please. So ethical committee clearance was obtained from the institutional ethical committee, and subject selection as per the inclusion and exclusion criteria was done, and a verbal consent was obtained from the participants, and a questionnaire was drafted and validated and then sent to email to the participant by using Google feedback form. And after that, after taking back those, after receiving back the feedback, the short telephonic interview was taken and data was recorded and analyzed. Next, please. So data was entered in MS Excel sheet and analysis was done by descriptive statistics. Next slide. So first pie chart shows the gender-wise distribution of the participants. So among total 30 participants, 18 were female and 12 were male. Next slide, please. So graph 2 shows the next slide, please. Yeah, the graph 2 shows responses of the participant to the questions given in questionnaire. So this questionnaire contained 15 questions and responses obtained in the form of yes or no. And there were 4 domains, respectively financial, professional, psychological and physical domain. And the response from the participant obtained was such as, in financial domain, 83% participant stated that they had an impact on their financial transactions, while 17% stated there was no such difference. 93% participants noted reduced patient footfall during this pandemic situation, while 7% noted no change. 53% physiotherapists included in this study are the sole earning members, while 47% had financial support from one or more family members. 80% of the participants denoted concern about their financial stability and security in near future due to this pandemic. Next slide, please. Next slide, please. So in physical domain, 26% physiotherapists had to undergo the isolation experience due to coming into contact with COVID-19 patients. 7% physiotherapists suffered from COVID-19 themselves due to clinical exposure. 73 reported physical difficulties due to continuous wearing of PPEs. 86% reported physical difficulty in managing safety of clinic single-handedly in terms of managing sanitization, refilling of stocks, treatment and administration. Next slide, please. Next slide, please. In psychological domain, 80% of them were constantly under the fear of risk of exposing themselves to COVID-19. 86% had the fear of risking their family. 92% of them felt it difficult to balance professional and family life during the pandemic. Next, please. Next slide, please. In professional domain, 73% reported that the pandemic had made it difficult to manage the safety of the clinic professionally. 93% physiotherapists had implemented newer methods like virtual consultation, like tele-rehab, to overcome the current difficulties. 93% of them felt virtual consultation was more helpful, but among them, only 83% reported that it was not possible to reach every patient using virtual consultation method. Next slide, please. So, physiotherapy profession has not looked the same since COVID-19 pandemic began to affect. Present survey provides information on the financial, social, psychological, physical problems faced by the physiotherapist working in private clinics. Physiotherapy clinic that stayed open during the early stages of the pandemic had fewer patients walking through the doors. Employment and income suffered in private clinics. Use and maintenance of PPEs along with other equipment has added additional financial burden. Next, please. The serving physiotherapists still have the risk of exposure to their family and they might have to go to long duration of being isolated. Some physiotherapists had to shut down the clinics due to the inability to pay the rent and maintenance. Physiotherapy involves treatment in close contact to the patient. So COVID-19 has posed a big challenge to this practice. Physiotherapists have to introduce virtual methods of consultation due to practical difficulties. But some physiotherapists have said that this
Your
method is
time,
less
your
satisfactory.
time is over. If you want to continue, your question answer session will not be conducted. Would you like to continue the session?
Yes, sir.
Or
Yes,
you want
sir.
to stop?
Continue, sir.
Okay. Continue.
Next slide, please. Next slide. Next slide. Next slide. So in conclusion, this study concludes that this pandemic has a considerable effect on financial, physical, professional and psychological aspect among physiotherapists working in private clinics. Next, please. Next. So limitation includes small sample size. Physiotherapists only from urban area were included. Future scope, this study can be done in multiple cities, including rural areas, to compare their responses from different participants. Next slide, please. This study recommends as the first wave of pandemic wanes, physiotherapists need to be prepared for the anticipated next wave. So the consideration will include replenishing supplies, including cleaning and disinfecting supplies, gloves and masks, reevaluating services that offered, developing competence to support future services, reviewing clinical policies, such as the clinical layout, booking, billing practices, patient screening practices, and continuous evaluation of what worked well and what didn't. So next slide, please. These are my references. Thank you.
Is any questions?
I don't have any question. Sorry, you can ask.
There was one question that how did you validated the questionnaire? Was it self-designed?
Oh, ma'am, this was yes, ma'am. This was self-designed questionnaire and it was given to 5 faculties, and the suggestions were welcomed, and we worked out on the questionnaire, and we feed in the Google feedback forms in the format online format.
Okay, and then why it was the need that you have to give a telephonic call and take the feedback when it was felt in Google form?
Yes, ma'am. Actually, this was in the format of yes and no. So it is simple to so in descriptive format, yes and no question type of question can be handled better. And to understand what was the basic problem, we have to undergo a telephonic interview so that we can know the problems deep in detail.
Okay, fine.
Timing for question answer is over. Can we move for the next one?
Yes, sir.
SR3?
Yes.
SR3, are you ready? SR3? SR3, you there? Okay, we'll go on to the next one. SR4, are you ready? SR3?
Hello, am I audible?
Yes, SR3, are you ready?
Yes, ma'am.
Okay.
Hello.
Yes.
A very good afternoon to the eminent judges, seniors. Hello.
Yes, start.
A very good afternoon to the eminent judges and my dear friends. Today, my topic of presentation is comparison of ankle brachial index in diabetics and non-diabetic subjects. Next. Diabetes mellitus is a metabolic disorder characterized by hyperglycemia due to deficiency of insulin. Diabetes affects limb arteries in two ways. First, by promoting atherosclerotic occlusive disease, and second, by arterial wall stiffening. Peripheral arterial disease is obstruction of blood flow in the arteries, resulting from atherosclerosis and embolism, thrombus formation, or inflammatory processes. Ankle brachial index is the most efficient, objective, and practical means of documenting presence and severity of peripheral arterial disease calculated by dividing systolic blood pressure of ankle to that of brachial. Next, please. The need of my study. This study was undertaken to see if diabetic patients have abnormal ankle brachial index indicative of peripheral arterial disease, and if so, can be detected in its early stage. Aim of my study is to compare ankle brachial index in diabetic and non-diabetic subjects. Objectives: to measure ankle brachial index in diabetic subjects, to measure ankle brachial index in age-matched non-diabetic subjects, and third is to compare the above two. Next, please. The material used were plinth, 2 pillows, mercury sphygmomanometer, EMCO mini Doppler D500 vascular ultrasound Doppler instrument with 8 megahertz probe, and gel. The methodology was type of studies: observational comparative study setup tertiary care hospital, study design, dichotomous study, two proportion, independent case control study, and sample size, that is N, is 118 in each group, means diabetic and non-diabetic group. In each group, 118 participants were included. Study population, age matched, diabetic and non-diabetic subjects, 118 in each group. Next slide, please. Yeah. The inclusion criteria of my study was the age group between 30 to 65 years, including both males and females. Group A is a diagnosed diabetic subjects referred from medicine OPD on medication for at least 2 years. And group B is subjects referred from medicine OPD with the normal blood sugar levels. Those were considered as a non-diabetic subjects. The exclusion criteria for my study was the subjects who are already diagnosed and having a peripheral arterial disease were excluded. Subjects having symptoms of claudication were excluded. Subjects who have undergone recent surgery or have injury in the extremities, lower extremities, excluded. Subjects having central nervous system disorder or organ damage were excluded. Subjects with history of deep vein thrombosis were excluded. Subjects having unilateral or bilateral lower limb amputation were excluded. Now the study procedure. Each subject was allowed to rest for 5 to 10 minutes in supine position. The systolic blood pressure was taken in following order. First, right brachial, then right posterior tibial, then right dorsalis pedis, then left posterior tibial, and lastly, left brachial artery. Now, ankle brachial index of each leg was calculated by dividing the higher of the posterior tibial or dorsalis pedis pressure by the higher of the brachial systolic blood pressure. The lower of the ABIs, with ankle brachial index, the lower value of left or right leg was taken as a subject's ABI value. Now the statistical analysis. Uncorrected chi-square test version PS 3.0.43 was used for sample size calculation, and the sample was N is equal to 118 in each group. Inter and intra-group comparison between diabetic and non-diabetic subjects was done by independent t-test, and data was normally distributed using SPSS version 16. The difference of the difference of number of the normal and abnormal ABI was measured by chi-square test. So next slide. Yeah. So the results, there was no significant difference in the mean age that is 54.6 and 55.4 years in group A, that is diabetic patients, and group B, that is non-diabetic subjects respectively. And P that is calculated was 0.177. So there was no statistically significant difference. That is, P value is equal to 0.51 in gender distribution in both groups. There was no statistical significant difference in mean ABI values, that is 1.039 plus minus 0.12 and 1.033 plus minus 0.09 in diabetic and non-diabetic subjects respectively. Next slide, please. Yeah. So this graph showing diabetic. So the blue shades shows the normal ABI values in diabetic and non-diabetic both, and the red zone shows the abnormal values in diabetics and non-diabetics both. Next slide. Yeah, the discussion of my study. This study shows the mean ABI values were 1.039 plus minus 0.12 and 1.033 plus minus 0.09 in diabetic and non-diabetic subjects respectively, which are within normal range, and normal range is 1 to 1.4. The reason for diabetic subject showing normal ABI could be the less duration of disease onset, and as they were diagnosed and on medication, the disease was controlled. So we got the normal ABIs in diabetics subject also. Now 38.13% abnormal ABI, that is less than 0.99 and more than 1.4, was found in diabetic groups, and 32.20% in non-diabetic groups.
7 minutes done. 7 minutes are over.
Okay. Next slide. In diabetic group, only 13.3% had low ABI. This result was supported by the study done on Indian Asian population, which showed there is a lower prevalence of PAD than Europeans. Now, in this study, all diabetic subjects who showed low ABI, that is less than 0.9, had a duration of diabetes for more than 10 years, which supported the studies on correlation of duration of diabetes and peripheral arterial disease. 6.6 subjects, all were males, found to have high ABI, that is more than 1.4 in diabetic group, which was indicative of presence of calcified arteries in lower limbs. This finding was supported by the same kind of studies. Next slide, please. Next slide. Yeah. Non-diabetic subjects showing abnormal ABI were 32.26. Which can be explained on the basis of presence of multiple risk factors such as hypertension, ischemic heart disease, tobacco use, and a high level of cholesterol. Studies have
03, you have utilized 8 minutes. If you want to continue,
yes. Continue. Yeah. Shown more number of risk factors which resulted in more decline in ABI values. We found there were more tobacco user subjects with ischemic heart disease and hypercholesteremia in non-diabetic group than in diabetic group. This could justify the reason for more subject of this group having abnormal ABI. Next slide. Now, conclusion of my study that there is no significant difference in the ABI values in diabetic and non-diabetic subjects as diabetics were on medication. The limitation of study, it would have been ideal to select patients only with diabetes to comment about cause-effect relationship, but practically it was not possible in a given time to find adequate number of such patients. Now, clinical implication, in-patient documentation and evaluation of ABI should be done to overcome underdiagnosed and should be done in older age group due to high prevalence. Next slide. Thank you. Thank you, ma'am.
What do you judges?
What I feel, whatever you have presented is amalgamation of 2 or more studies. The facts are already established because it's very unlikely that you may not have value. The studies which you have reflected in your discussion have all these facts were already there. There's the textbooks in the evidences and everything. And somewhere in the discussion you have mentioned that calcification happens. You know that the structural changes are quite and at the extensive level when we get ABI differences. Okay? Yes.
Yes,
So
ma'am.
and then you are again giving an explanation कि medicine work कर रहा है इसलिए मुझे ABI के daily. This is in contravention if you are with your both these sentences are in contravention. Can you explain that?
Ma'am, calcified arteries will show you ABI more than 1.4, but my studies shown that
No, you're claiming that medicines which are there were being taken, and that's why ABI के values नहीं आए हैं मुझे. And that it's not like we cannot accept that. Reversible नहीं होते हैं changes usually. Sorry, you can ask.
No questions, ma'am, because I was about to ask the similar thing, ma'am.
Yeah.
Okay.
Okay, thank you. Can we move ahead?
Yes.
05, you are ready?
Yes, sir.
Your time starts now.
Good afternoon, everyone. The topic of my presentation is effect of 4 weeks of Zumba versus aerobic dance training on cardiorespiratory fitness in young overweight females. Next. Physical inactivity is a critical public health issue today. So today, due to this scientific development, man is enjoying the highest levels of physical comfort. He rides instead of walking, he sits instead of standing, and watches instead of participating. Such changes lead to inactivity, leading to a variety of diseases. Next slide, please. Such as obesity, type 2 diabetes mellitus, heart diseases. Excessive body weight also impairs the cardiorespiratory functioning and cardiac mechanical efficiency, thus reducing the exercise tolerance and aerobic capacity. As we live in the modern era, along with physical inactivity, people are now becoming more aware of its side effects and how to overcome them. Next slide, please. The young population takes various forms of exercises to keep themselves healthy, and more interest has been shown in recreational physical activity exercises. A lot of young population take into account and have shown interest in various dance forms to engage in the physical activity. Zumba and aerobic dance trainings are the two most liked and preferred, especially by the young female populations. Now, Zumba is a Latin American dance form, which is a free-flowing and goes with the dance flow, along with it also has improvements seen in reduction in weight, improvement in the muscle strength, and also in the cardiovascular fitness. Whereas aerobic dance training is based mostly on particular steps that are focused on muscular activity, working out in a particular pattern that follows along with the music. Next slide, please. Now, there are studies which have showed positive effect of Zumba and aerobic dance training on cardiorespiratory fitness in healthy individuals, in sedentary women, in postmenopausal women, overweight, middle-aged women. But there is a lack of literature on the comparison between the between the effects of the two on the cardiorespiratory fitness as well as in young overweight females. Hence, the need arises. Next slide. Now, the aim of my study was to compare the effect of 4-week Zumba versus aerobic dance training on cardiorespiratory fitness in young overweight females. Now, objectives were to assess the effect of Zumba using the Howard step test. The second one was to assess the effect of aerobic dance training using the Howard step test. And the third one was to compare the two. Next slide, please. Now, the study was a comparative type of study which included convenient sampling. It was carried out over a period of 6 months and had a sample size of 54, which included 27 in each group. Now, we included the females between the age group of 20 to 30 years who were in the overweight category, that is BMI 25 to 29.9, and those who were not involved in any kind of exercise program for the last 6 months. Now, we included those with any kind of medical conditions like uncontrolled diabetes, hypertension, diabetes mellitus, any kind of neurological conditions, and subjects who have any kind of musculoskeletal disorders or recent fractures. Next, please. Now, ethical clearance was taken. Participants were selected according to the criteria, and baseline data was collected. The participants were divided into two groups, that is Group A, which was Zumba, and Group B, which was aerobics, and consisted of 27 and consisted of 27 each. The protocol was consisted of 30 to 40 minute session respectively, and the main session was 20 to 30 minutes, which was performed for 3 times a week. After the completion of the protocol, the
vitals were taken and the parameters were again calculated. The data was collected and analyzed using the PET test. Next slide, please. Now going on towards the protocol, so Zumba protocol consisted of the warm-up and steps like march, step toe, side to side, which consisted for 8 to 10 minutes. Now each Zumba training, which consisted of 20 to 30 minutes, was for 8 to 10 original Zumba fitness songs as instructed by the instructor, and then followed by the cool down, which consisted of slow dancing and stretching for 8 to 10 minutes. Next slide, please. Aerobic dance protocol consisted of again warm-up, which was of the same steps for 8 to 10 minutes, whereas the protocol of aerobic dance training consisted of rapid movements, which included heel digs, step down, step touch, left hand the pre and post between the pre and post data. Results were a study conducted by Lars Donath in 2014, which showed improvement in the cardiovascular function in college-going students between the age group of 20 to 24 in an 8-week protocol. Now, there is an increase in the need for oxygen by the muscles. Now, this requirement is obtained from the ventilation and exchange of oxygen in the lungs. Zumba makes getting it more easier. Whereas if you see in graph 2, there is comparison between pre and post values of VO2 max for group B, that is aerobics. Again, we have a significant difference that is seen, and it is also statistically significant, where the p value is less than 0.0001. Now, this was again in line with the study conducted by P2 Sil et al. In 2018, which states there is significant improvement in the muscular strength and endurance of adolescent school-going girls. Now, the improvement in VO2 max in the aerobic dancers was due to the decreased peripheral resistance, there's increased cross-sectional diameter of the coronary arteries, and the enhanced tone of the ventilatory musculature. Next slide, please. Okay, now here we can see the comparison between the post values of VO2 max for both group A and group B. Again, we can see there is a significant difference which is seen, and Zumba shows a better effect compared to that of the aerobic. Now, this was also considered extremely significant. Now, the study findings were in line with the study conducted by Kumar et al. In 2016, where they studied the effect of the two on college-going girls aged between 18 to 24. And they showed that there was improvement in the cardiovascular endurance as well as the BMI, that is the weight reduction was also seen. Now, this may be because of the Zumba trains the lungs to work more efficiently to absorb more oxygen, causing increase in the VO2 max. It also strengthens the abdominal and the respiratory muscles, improving the diaphragmatic movements, lung compliance, and thereby the capacities. Now, Zumba makes getting your targeted heart rate much easier than the standard workout routines. Now, exercising, we all know, exercising for a prolonged period at the high rate will strengthen the heart. Thus, it will again help in improving the cardiovascular fitness. Again, we all know that, yes, cardiovascular fitness was significantly linked with time spent in the physical activity and not only with the intensity. So, when we perform high intensity exercises or when you perform a moderate intensity exercises, the timing which is performed is also very important. That is what implies. So, next slide, please. So here I conclude saying that the study concludes that Zumba is better than the aerobic dance training to improve the cardiorespiratory fitness as measured with Harvard step test in young overweight females. Also, there was a small limitation that we found out in our study was the sample size which we had taken was a little smaller, as well as we had not seen the over effect, that is the long-term effect of the protocols that we had taken. And further implications that we can use Zumba in case of training, because Zumba is a free style dance. That is, you have to just follow the instructor or you have to just follow the music. Whereas in aerobics, you need to follow a particular step. And that is also can be a restriction for a few people also. So I conclude saying that Zumba is a better aerobic dance, is better than aerobic dance training. Next slide, please. These are my references. Next slide. Next. Thank you.
Over to the judges.
Gauri, you can ask first.
Ma'am, I just wanted to ask one thing, that any form of I mean, cardiorespiratory fitness is dependent on two things. One is intensity and another is time. Okay, since the
Yes, ma'am.
timing was kept quite constant and
Yes.
intensity Zumba ka already higher रहता है, it was quite predictive that the results of Zumba would be more as compared to, in terms of VO2 max, would be more compared to aerobic dance. So it was quite predictive from beginning only. Because
Ma'am,
it is,
yeah, sorry.
yes.
I would like to say about this is if you see aerobic goes from moderate to high intensity as well. So aerobic
Your
has that
aerobic dance, you had not
characteristic. So
specified
if we
any
have
kind
a
of
higher,
intensity. In your aerobic dance style, you had not specified any kind of intensity of that dance. And in Zumba, it is already well defined a high intensity dance. If you would have added the intensity criteria at your aerobic dance also, targeting heart rate, achieving this kind of target heart rate or something else, then definitely we could have seen the equal level comparison is there.
right. Ma'am, we had not given the protocol. We were just following the protocol that was given by the instructors. So when we had actually compared it, we had found out that it was a higher intensity exercises only. But yeah, as you said, obviously heart rate target achieved we should have taken, but we haven't taken that, ma'am.
Okay.
So should we stop? Should we go on to the next?
Yes, Shilpa ma'am, any questions?
No question from me.
Shilpa ma'am, shall we
Yeah,
go on
yeah,
to the next?
we can move.
Okay, ma'am. SR06, are you ready? SR06. SR06, are you ready?
Yes, ma'am.
Okay. Start.
Good afternoon, everyone. My topic for paper presentation is perceived barriers to exercise in subjects with type 2 diabetes mellitus. Next. Next slide, please. Introduction. Diabetes has become a widespread epidemic with rising physical inactivity and obesity being the major contributing factors. As we know that regular physical activity or exercise is a cornerstone of lifestyle modification and is recommended since it can prevent and manage type 2 diabetes mellitus and its related comorbidities. Type 2 diabetes mellitus is the sixth leading cause of death, with most deaths attributed to cardiovascular disease, which accounts for nearly 70%, and with ischemic heart disease being responsible for nearly 50% of the deaths. Next slide, please. Lifestyle modifications, which includes changes in day-to-day habits, are an essential component of any diabetes management plan. Exercise, which is often viewed in relation to glycemic control, has important effects on the development of cardiovascular complications in type 2 diabetes mellitus. Improved blood sugar control can slow the progression of long-term complications, and exercising helps in improving the blood sugar levels. Next. For diabetic individuals, exercise promotes cardiovascular fitness and weight loss. It lowers the high blood pressure. It improves the lipid profile. It improves blood sugar control in some cases and leads to an overall sense of well-being. Exercise has a beneficial effect on insulin sensitivity in normal as well as insulin-resistant population. Next. Need of the study. Despite the clear evidence that physical activity or exercise is a key element in controlling and managing type 2 diabetes mellitus, individuals with diabetes are among the least likely population to engage in regular exercises, and the adherence to exercise is surprisingly poor. More than 60% of the patients with type 2 diabetes mellitus remain sedentary. So finding out perceived barriers to exercise are important so as to find out ways to solve the barriers. This information is also needed in order to develop effective exercise counseling contents and methods to motivate and help sedentary overweight adults at high risk or already diagnosed with type 2 diabetes mellitus individuals to exercise regularly. Next. The aim of my study was to determine the perceived barriers to exercise in subjects with type 2 diabetes mellitus, whereas my objective was to determine the perceived barriers to exercise in subjects with type 2 diabetes mellitus using exercise benefit barrier scale questionnaire. Next. Methodology. Study design. It was a cross-sectional study and the sampling was convenient sampling. There is a mistake here. It's convenient sampling. Setting. All patients diagnosed with type 2 diabetes mellitus visiting medicine OPD were included in the study. My sample size was 100. The materials used were pen, paper, conform, exercise benefit barrier scale. Next. Criteria. The inclusion criteria was individuals diagnosed with type 2 diabetes mellitus were included in the study within the age group of 35 to 60 years of age. Both males and females were included, and individuals understanding English were only included in the study. My exclusion criteria was subjects with any other respiratory or cardiovascular comorbidities were excluded from the study. Next. Procedure. So for the study, 100 subjects were included in the study who were diagnosed with diabetes mellitus. The individuals were informed about the survey and complete procedure was explained to them. They were also asked to fill the consent form regarding the survey. Each individual was assessed on the basis of exercise benefit barrier scale questionnaire. It is a 43-item questionnaire which includes 14 questions for the barriers, whereas 29 questions for the benefits. These questions are clubbed together so as to avoid bias. The demographic data of the individuals was recorded, and they were asked to mention that whether they exercise or not, and if they're and even if they exercise, what kind of exercise do they perform? And after filling these data, they were asked to fill the 43 items exercise benefit barrier questionnaire. Next. The individuals were given the form and they were asked to give opinion on each particular statement by choosing any one of the option, and the options were strongly agree, agree, disagree, and strongly disagree. Next. Then once the form was filled, the scoring was done, and the scoring was done on a 4-point scale. For the benefits, the item was scored as follows. For strongly agree, they were given 4 points. For agree, 3 points. For disagree, 2 points. And for strongly disagree, 1 point. Whereas for the barriers question, the scoring was done in a reverse order. That is, for strongly agree, 1 point was given. For agree, 2 points. For disagree, 3 points. And for strongly disagree, 4 points were given. Then the results were formulated by considering amongst 100 individuals, how many of the individuals considered a particular statement, like how many of them replied strongly agree or agree to the benefit part, and whereas how many of them disagreed or strongly disagreed to the barrier part. And then the statistics was carried out. Next. Results. Now this particular graph shows the barriers that the diabetic individuals face to exercise. The x-axis mentions the question number of the barrier, whereas the y-axis denotes the percentage of the individuals who opted for that particular question as strongly agree or disagree. So out of these 14 questions, the most frequently occurring barriers were considered as question number 4, 42, question number 6, question 37, and question number 40. Next slide, please. So the above graph explains that 93% of the population opted for the question number 4, which states that the population feels that the exercise taking too much of their time is a barrier. The next barrier that we found was that the population feels that too few places to exercise is a barrier. And whereas the next barrier was 85%, for which the population said that they feel that the exercise tires them. So we can say that the most frequently occurring barriers were question number 4, 42, and question number 6. Next. Next. Okay. Next. Discussion. So amongst the barriers, it can be said that exercise taking too much of their time, very few places to exercise, and exercise tiring them are the primary or the most frequently occurring barriers amongst the individuals with type 2 diabetes mellitus. Exercise taking too much of their time may be a barrier due to their busy schedule or giving less importance to exercise in their daily course or less awareness to benefits of exercises. So individuals should be made aware about the benefits of exercise and also its importance in day-to-day activity. They should also be encouraged to include the exercise regime in their daily schedule, or they won't so that they won't have to take out time separately for the exercises. Next. Too few places to exercise may be a barrier because they may feel that there is not enough open space available for them to exercise, or no proper environment is available for them to exercise. So in such cases, the individual should be made aware that the exercise doesn't need a lot of space or a perfect environment. They can also exercise at home, and for such individuals, home exercise program can be formulated. Also, groups can be formed where individuals with similar age group and medical condition meet up and perform an exercise session for an hour or so.
Last 1 minute.
Yeah. So as exercise tiring them is also accepted as a barrier. This may be because the individuals may be having hypoglycemia, which leads to early tiredness, hence restricting them from exercising. So for this, the individuals can be given exercises with sufficient breaks in between so that it doesn't tire them. So while planning rehabilitation for diabetic individuals, these barriers should be kept in mind, and also ways should be found out to deal with the frequently occurring barriers. Next. Conclusion. So this study concluded that exercise taking too much time, very few places to exercise, and exercise tiring them are the most frequently reported barriers by type 2 diabetes mellitus individual. So there is a need of proper awareness about the exercise and encouraging its benefit and solving the barriers so as to make them readily acceptable to the exercise protocol and prevent them from various cardiovascular health hazards like CAD and other complications of diabetes mellitus. Next, please. Limitations of my study. The limitation of my study was that individuals understanding English were only included in the study. Also, exercising as well as not exercising individuals both were included in the study. Next, the future scope of study was that the same study can be done in a definite age group. It can be done as a comparison between males and females, and it can also be done as a comparison between exercisers and non-exercisers. These are my references. Next. Thank you.
Judges, any questions?
I feel one thing, like you failed to mention one important aspect. Like, of course, there are barriers for exercise and the kind of barriers you explained, we accept them. But it is a proved fact that simple half an hour, 5 times a week have substantial benefits for the diabetes. Okay, and you failed to focus on that because time constraint was, and they have already said that it did not be half an hour full. It can be 10 minute bouts for in a day also. Okay, so they can get 10 minutes in bouts. So you simplest form of replacement of a very trained exercise program or lack of space that would take care of that problem.
Okay.
Over to you, Gauri.
Okay. Yeah, ma'am.
No questions, ma'am.
No questions?
No questions.
Okay.
Thank
so
you, ma'am.
we will go to the last presentation in the senior category. SR number 7, SR07. Are you ready? SR07. SR07. This is the last entry. SR07. SR07. Can you hear me? Okay, since SR07 is not available, ma'am, can we start with the junior category?
Yeah, definitely.
Okay, ma'am. Yes. JR01, are you ready? Just 2 minutes. Hello, Piyush. Omkar, can you help him unmute? SR07. Can you help him unmute? Can you help the candidate getting unmute, whoever he or she is? Are you there? Mr. Piyush? And we'll just wait for 2 minutes if we are able to solve this technical issue. Otherwise, we'll move ahead. No problem.
Yes, yes.
Hello. Hello. Am I audible? Hello.
Okay, we can start with the presentation for CBR SR0.
Hello.
07. Yes, can we start?
Technical delay. Good afternoon, everyone. The title for my study is a pilot randomized control trial of interval training.
Just please, can you?
Hello. Yes, ma'am.
Yes, just 1 minute. I'll share the PPT.
Yes, sure.
Yes.
Hello. Yes. The title for my study is a pilot randomized control trial of interval training and sleep hygiene for improving sleep in the older adults. Next slide, please. Sleep is a very important function in our lives, and despite its significance, it gets ignored quite often, more often in elderly population. The prevalence of insomnia is very high in Indian population, which is around 32%. Study done by Gambhir et al. In 2014. Also, very few treatment options are available, and more options available are pharmacological. Sleep is even more disturbed in older adults living in old age homes, and more often sedative use is very high in these adults with living in old age homes. And so, sedative use is associated with falls and cognitive impairment. Also, antipsychotics which are taken by the people in the old age home lead to metabolic syndrome, thromboembolism, and cerebrovascular and cardiac events. Next slide, please. The older adults who sleep for a shorter period have less likelihood of exercising and meeting the physical activity guidelines. Therefore, this thought was developed that exercise might improve the sleep in older adults. Continuous moderate intensity training shows modest result as shown by a Cochrane review. Next slide, please. Interval training consisting of short periods of high intensity and interspersed with low to moderate intensity exercise may serve as a substitute for continuous high intensity exercise. Next slide. Studies have proved that there is more improvement in exercise tolerance as compared to high intensity interval training as compared to the continuous moderate intensity training. And HIIT has proved to give better results in VO2, and also it requires less time and elicits more enjoyment and can increase the exercise adherence than the continuous moderate intensity exercise. Next slide, please. In summary, considering the added benefits of the interval training over continuous moderate intensity exercise, interval training may be a viable non-pharmacological treatment strategy to improve sleep in older adults. Next slide, please. The primary aim of the pilot study was to determine the feasibility, and secondary aim was to understand the effects of intervention, that is interval training and sleep hygiene, on objectively and subjectively measured sleep in older adults. The objectives for next slide. The objective for this study were to analyze the results and to explore the experiences of participants and to determine the participant recruitment rate and retention rate for both interventions in percentage. Next slide, please. Study design was mixed methods, quantitative as well as qualitative data was analyzed. Study setting was an old age home. Next slide, please. The inclusion criteria for the study was age between 60 to 85 years and difficulty to wake up and initiate sleep, and scoring greater than 5 on Pittsburgh Sleep Quality Index questionnaire. Exclusion criteria was history of sleep apnea, any cognitive neurological disorders, consumption of caffeine, smoking, or any alcohol abuse, depressed people, then any other severe medical condition which might limit the participation in BMI more than 35 kilogram per meter square. Next slide, please. Randomization, permuted block randomization was done. There were two groups. Interval training with sleep hygiene was one group, and another was sleep hygiene alone group. The study investigators were blinded. Next slide, please. The interval training program consisted of 3 days a week for 8 weeks, amounting to 24 sessions. Intensity was based on IMPAR method of HR max. The formula is given on the slide. There were two periods. One was recovery period of 65% HR max and high intensity of 85% HR max. Next slide, please. The time duration was around 30 to 35 minutes. There were 4 minutes of one bout and 8 bouts were given to the participants. Each bout had got around 3 minutes of cycling at lower intensity, which is 65% HR max, and then high intensity, which is 1 minute of 85% HR max. And the type was given on a bicycle or outcome measures PSQI, that is Pittsburgh Sleep Quality Questionnaire, and S plus sleep monitor, which was used for objective sleep data. Next slide, please. This is the picture of the sleep monitor. This was placed at the bedside to understand the results of the sleep. Next slide, please. This is the smart. This device was connected to the smartphone, and this is the result which we get with the data on the smartphone. Next slide, please. Then quality of life was measured with SF12. Then face-to-face interviews were taken for getting the qualitative data. Next slide, please. The picture of the participant performing interval training. Next slide, please. For sleep hygiene, we delivered a 60-minute duration lecture to understand about the topic of sleep hygiene, and then a handout was given, which consisted of American Sleep Association guidelines for improving sleep. Next slide, please. This is the chart for the, according to consort, around 13 participants were randomized. First, 76 participants were screened and 46 were assessed for eligibility. 13 participants were randomized to two groups, interval training with sleep hygiene and sleep hygiene alone. There was one dropout in sleep hygiene group. Next slide, please. Statistical analysis for quantitative study, ANCOVA was used, and for qualitative study, thematic analysis was used. Next slide, please. The percentage of retention in interval training group was 100%, and for SH group was 85.7%. There was only one participant who had dropped out. Intervention acceptability was good because more than 80% of there was attendance of more than 80%. Then average attendance was 86%, and the recruitment rate was 38.2%. Next slide, please. This is the table for the baseline characteristics. Next slide, please. There was no difference between the baseline characteristics. The mean difference, there was a major difference in the global PSQI score between the interval training and the sleep hygiene group. The difference in the global PSQI score was more than 3 in the ITSH group as compared to that of only 1.65 in the sleep hygiene. Next slide, please. There was a major improvement in the wake time and the number of disruptions as measured by the objectively measured sleep with S+ sleep monitor. There were total reduction in depression, number of disruptions of 3 as compared to that 0.85 in sleep hygiene. Next slide, please. The mean difference in physical component score was more in interval training with sleep hygiene group as compared to that of sleep hygiene alone group. Next slide, please. When assessed, while the qualitative data was assessed, the improvements, the participant reported that it surely improved my sleep. I felt more energetic, and if I don't do the cycling, I'm missing something. There was some qualitative data from this. Next slide, please. About sleep hygiene, the participants reported improvements or positive points like I like writing about my sleep, and it helped me to follow the instructions daily. Next slide, please.
Last 1 minute.
Problem faced, and next slide, please. Discussion. Since primary insomniacs have a documented reduction of heart rate variability, the reduction in the high frequency component of heart rate variability was important, and anxiety and stress relief were the important parameters which reduced the which promoted and improved the sleep in the elderly population. So during our study, we explained the importance of physical activity and sleep, but separate session emphasizing the same could have been taken for older adults. This is a limitation. Next slide, please. Conclusion results from the study suggest that 8-week interval training with sleep hygiene is feasible. The changes were in favor of interval training, and there was a good retention rate of more than 80%. Next slide, please. These are the references for the study. Thank you for listening patiently.
One very important question which I want to ask you is whether you had assessed them for the comorbidities, because your range is 60 to 85. So starting from young old and going to old old. Okay, and according to that, the intensity with which they exercise. How did you describe the intensity of exercise for such a varied 60 to 85, 25 years of it? With every 5 years, these individuals undergo changes in their fitness. Just want to answer, and normality of check, I suppose, so that you can generalize it to general population.
The mean age was around 72. The participants were quite, they could perform the intervention. So there were 2 participants who were not able to perform it. They used to have some problems while understanding the increase in the intensity and less in the intensity. However, after 3 sessions, they were given some 3 added sessions for understanding the program, and with that, they were able to continue with the rest of the sessions.
And the device which you use seems to be quite costly. And you said that these all patients were belonging to some, foundation where they were kept together.
Old age home, yes, ma'am.
They were not community dwelling,
No,
right?
no, ma'am. They were institutionalized old age home.
So did you sponsor them all the device?
No, ma'am. Actually, it's my device only. I purchased it on my own.
Okay, Gauri, questions on your side?
No questions, ma'am.
Thank you, ma'am. Thank you.
Thank you, sir. Thank you, ma'am. So with this, we come to the end of the paper presentation in senior category. Ma'am, shall we start with the junior category?
Yes, yes, you can.
Okay. JR1, are you ready? JR1? JR1? Unmute yourself. JR1? Can you unmute yourself? JR1? Mr. Piyush, can you help JR1 to unmute yourself, unmute them? Mr. Omkar, can you help? Mr. Omkar, can you unmute JR1? We'll just wait for 1 minute.
Please unmute.
Am I audible?
Yes, yes.
Okay.
Let me share the screen.
Yes, ma'am.
Your time starts now.
Okay. Very good afternoon to the dignitaries present. My topic for today is comparison between chest PNF and inspiratory muscle training on chest expansion in patients with restrictive lung diseases. Next. Restrictive lung diseases are a category of pleural or parenchymal respiratory diseases which restrict the lung expansion and leads to reduced lung volume, increased work of breathing, inadequate ventilation, and or oxygenation. Next. Various chest PNF techniques are applied at the end of expiration so that the efficiency of next inspiration is promoted and enhanced. These techniques include intercostal stretch, vertebral pressure, anterior stretch of basal lift, moderate manual pressure, perioral pressure, and abdominal co-contraction. Next, IMT is a series of breathing exercises that aim to strengthen the respiratory muscles, making it easy for the patient to breathe. IMT devices have preset resistance through which the patients breathe and proper rest interval is given. Need of the study. There are various studies that have proven effectiveness of chest PNF and IMT on COPD population, but very few literatures are present about the same on restrictive lung disease population. Therefore, my study is focused to study the expansion by comparing which treatment is more effective and better. Next. Aim of the study was to check for effectiveness of chest expansion by comparing different chest PNF techniques and inspiratory muscle training in patients with restrictive lung diseases. Next, objective were to study the effect of chest PNF in restrictive lung disease patients by tape method, to study the effect of IMT training on chest expansion by tape method, and to compare which of the two was better in patients with restrictive lung diseases by using tape method. Inclusion criteria was both males and females were cooperative, aging between 21 to 65 years of age with restrictive lung diseases. And exclusion criteria was patients with dyspnea level of grade 3 and 4, and patients with neurological, musculoskeletal, cardiovascular diseases, and patients who had language barrier were excluded. Next. Methodology. So we did an experimental study with comparative design with simple random sampling in PCMC area with 30 as the sample size, and the study duration was 6 months with 1 week of follow-up. Next. First, so that ethical clearance was taken and screening of 50 patients were done, out of which 30 were included as 20 did not fit the exclusion criteria. The informed consent of the patient was taken, and then they were divided into two groups, namely A and B. Baseline measurements for both groups A and B were assessed by chest expansion by tape method. Group A received chest PNF techniques 3 to 4 times with rest period of 20 seconds between each repetitions for a week. And Group B received IMT trainings, 2 cycles of IMT. Each cycle was of 15 to 20 minutes with 5 to 6 breathing cycles through minimum resistance, which was set at 21 to 23 centimeters of water for a week. Both groups were assessed by chest expansion. Data analysis was done by doing paired T test within groups and unpaired T test between the groups. That is pre and post of group A by paired T test, and and post was done by unpaired T test. Primer, Instat GraphPad softwares were used. Next. So group A PNF showed better results in chest expansion at supramammary, mammary, and inframammary levels with mean of 3.69 plus minus standard deviation of 0.9344 in supramammary. In mammary, it was 3.77 plus minus 0.3595, and in inframammary, it was 3.74 plus minus 0.3582. From the results of statistics, it was seen that there was increment in both the chest expansion, both the groups with PNF and IMT both, but there was a better increment with chest PNF when compared with group B. So it was statistically significant in both groups. So the p values were less than 0.001, making it highly significant. But when we compared it between the groups, it showed it was insignificant statistically with p values of 0.425 in supramammary, p values equal to 0.739 in mammary, and p values equal to 0.5547 in inframammary. Next. So according to the graphs, we can see that the pre-value of the PNF and post value of PNF shows increment, whereas the pre and post values of IMTs shows increment, but not as much as compared to the PNF groups in both the 3 levels, in all the 3 levels. Next. Our study is in accordance with Donna Fraunfelter, Kendall, Dominic Delvig, who stated that individually both chest PNF and IMT improved chest expansion. So this was based on neuronal signals that caused more muscle fibers to contract and recruit them. So it increased the strength. It concluded that stretching the ribs, intercostals, and diaphragm activated the stretch reflex and helped the patients to take deep inspirations. Next. This is the same study which was conducted by Kendall. So it showed that respiratory muscles improved. The strength was improved. The length tension relationship was improved of the accessory ventilatory muscles and improved the inspiration and expiration. Next. This is the study which was conducted by Dominic Delvig, and it proved that additional IMT improved and enhanced the functional exercise capacity and increased the respiratory muscle strength and increased the chest expansion. Next. After carrying out these interventions, it was proven that there was increase in chest expansion in group A, that is PNF group, by activation of the stretch reflex and expansion of the alveoli. In group B, there was increase in muscle strength, which improved the vertical excursion of diaphragm, leading to more recruitment of alveoli and increased chest wall mobility. Hence, it was concluded that there was better increment in chest PNF group, that is A group, as compared to B group. Next. So this is the conclusion, which states the same as I said earlier. There was increase in chest expansion in group A as compared to group B. Next. The limitations of my study were the follow-up duration was less, that is 7 days. Sample size was 30, which is less. And the resistance that was set in the IMT device was constant and minimal. That was, it was set at 21 to 23 centimeters of water. Next. Recommendation and future scope. It can be done on larger population. The study duration can be longer, and the after quite strength is achieved, the patients can be progressed from IMT to RET, that is respiratory endurance training device. Next. Clinical implications. The clinical implications of my study states that chest PNF techniques can be given to patients to increase chest expansion. These are my references. Thank you.
I have only one question for you.
Yes, ma'am.
Aren't the indications for respiratory PNF and inspiratory muscle trainer otherwise are totally different? And there is no doubt that you have got better results. Your outcome measure was measuring chest expansion.
Yes, ma'am.
And one more thing, the pathophysiology of COPD. An indication of both of these interventions is different in obstructive condition and a restrictive condition.
Yes,
And
ma'am.
the respiratory muscle trainer, the intensity decider is a very sensitive area of cardiorespiratory medicine. You have to go with caution, especially
Yes.
and which restrictive is a general term. What was the clinical condition of that population?
Ma'am, we had included all restrictive lung disease patients. So, ma'am,
my dear, every restrictive disorder is different than it can be a pleural effusion, pneumothorax is different. Then you have some empyema-like condition. It's different. It's
yes,
totally
ma'am.
different.
Ma'am, but then we had taken the baseline measurements of all the patients and we had set it to one constant level. So that is why we had baseline before beginning the
The
test.
first thing is the indication for both of your interventions are different. So they cannot be compared like that. That is my opinion, of course.
Ma'am, but then the physiology that we undertook was there was a reduction in the chest expansion. In group B, that is IMT, was because of reduced diaphragm strength, and in group A, that is PNF, was because there was less recruitment of alveoli. So our basic motto was to improve the strength in group B and enhance the chest expansion, whereas in group A, it was to cause recruitment of alveoli and increase the chest expansion.
So that totally going into like one is at cellular level, one is at tissue level. Gauri, over to you.
Ma'am, no questions.
Thank
you. No questions, ma'am.
Okay, thank you, ma'am.
Thank you. JR03. JR03, are you ready? JR03, are you able to unmute?
Yes, ma'am.
Yes?
Yes.
Okay.
Am I
Can you be
audible?
a bit louder? Yes?
Yeah.
JR03? Can you be a bit louder?
Am I audible, ma'am?
Please keep the mic closer.
Am I audible now?
Yes.
Can you please check?
Little bit louder.
Check now. This is the highest volume I can. Yeah.
Start.
Yeah, as the coronavirus pandemic unfolds across the globe, threatening the lives and stacking the world economy, it is also showing the other side of coin, that is the bright side of pandemic. So good afternoon, everyone. Can you please change the slide? Yeah. In December 2019, in Wuhan city of China, a novel coronavirus has garnered global attention due to its rapid transmission. The mode of transmission across the globe was through human direct or indirect contact. World Health Organization termed the infection as coronavirus infection 2019, that is COVID-19. Can you please change the slide? Yeah. The virus causes severe respiratory infections with dry cough, high fever, body ache and fatigue, and the main source of infection was through human contact, that is from the droplets of infected person. WHO declared the disease outbreak a pandemic, and since February 2020, affected countries have locked down their cities, industries, and restricted the movement of their citizens to minimize the spread of the virus and to curb the community spread. In spite of the negative aspects of coronavirus on the globe, the coronavirus crisis brought a positive impact on the natural environment as well. countries where the movement of citizens was seized to stop the spread of coronavirus infection have experienced a noticeable decline in pollution and greenhouse gases emission. And in India, after national social lockdown was imposed, environmental quality improved drastically as well. Markets were shut. Can you please change the slide? Yeah. Markets were shut, places of worship closed, public gathering is banned, travel restriction was imposed, works were halted, and economy as well as stock exchange was crashing worldwide. But from climate perspective, just a minute, can you please keep it there only? Yeah. But from climate perspective, the coronavirus pandemic brings about many positive aspects which the world witnessed during the lockdown. This further hypothesized to influence the environment and human health, and this study is positively weighing the bright side of pandemic. Now concentrating on CO2 emission, that is carbon dioxide emission, because of lockdown imposed, there's been a steep decline in travel and economic activity worldwide. Traffic congestion in major metropolitan cities fell down dramatically with reduced emission of pollutants like carbon monoxide. Airplane emission of carbon dioxide reduced as a result of shelter in place imposition. The issue with airplane emission pollutant is that it was estimated to triple by 2050, according to the United Nations Aviation Body, and yet suddenly the demand has dropped drastically and recorded accordingly. The improvement in air quality was observed due to stay-at-home orders as effective of less carbon emission and slowing global warming. Now, can you please change to the next slide? Concentrating on waste production and management during pandemic brought more light on medical waste. The increase in demand of one-time usable gloves, masks, and PPE came into existence and resulted in huge production of waste. And here the non-governmental organization, many such individuals also came into existence and created low-cost, feasible, and easy to recycle products, helping to manage the medical waste globally. One such example is of PPE kit when it was, just a minute, when it was very much infeasible for us to provide it. One of the small scale industry has created own PPE kits which are now being recycled and reusable. Next, please. Yeah, since the coronavirus pandemic began, an idea began circulating online that the earth is regenerating itself. Suppose sighting of wildlife roaming free in urban areas gained a whole lot of limelight. Indian social media went wild about footage of a stag scampering through Dehradun, which is one of the crowded city and one of the most visited city in India. And talking about the consumption of energy, can you please change to the next slide? And talking about the consumption of energy, the industrial sector demand dropped drastically. However, the demand in residential sector increased. But comparatively, the demand in residential sector was less as compared to the industrial sector. And it is creating a huge difference in production and conservation. Next slide, please. Yeah. The lessons that we learned from COVID-19 induced lockdown, concentrating mainly on the conservation and healing of nature and climatic change are, we have started using eco-friendly products, minimizing the use of chlorofluorocarbons. We have adopted renewable energy sources. We have promoted reusing and recycling of waste. Now we are planting more trees and we are avoiding more and more deforestation. Then treatment of sewage is getting more and more efficient and more effortless now. And next slide, please. We are maintaining ecological balance and concluding more in-depth insights into environmental and health parameters by connecting and converging various pollution aspects into light. We have also enlightened the importance of preserving and growing the natural reservoir to have a better environment and healthy life to attain sustainable development. And stating, change the slide, please. One more time. Yeah, a storm for human, calm the nature. Thank you.
So, natural resources, you have totally forgotten about water. If you remember very well,
yeah,
we have been asked to wash our hands so many times during the pandemic. Did you ever count water resources you have totally neglected in your study because there was excessive use of water?
The thing is, ma'am,
during the pandemic. for washing hands, because we have been told to wash our hands, like, and we Indians are more, at least me, I want water to wash my hands. So instead of sanitizer, I would always prefer soap and water. How will you explain that? That impact
in future scope of my study.
What do you?
Ma'am, what we can do is, there was a huge implementation of water conservation, one part. Secondly, the aquatic life cycle was improved because the pollutants were not reaching the natural reservoir.
Such a short period will not replenish the water content.
No, but the thing is, we are putting many.
If you just observe since last 2 years, there was an over. Yes, I do agree that because of the carbon emission going down, it might happen. It is changing the environment like anything. We have no winters now, no winters. Last summers and last rainy season. Rain starts late and goes till December, and no winter. Even that is going to have an impact.
The thing is, ma'am, dolphins were observed near the in Spain when the this lockdown was imposed, and the more clear sewage water was found, and all these things were.
There has to be conscious efforts, lessons learned, but you have to make conscious efforts to take care of all this.
That is one part.
If economy gets battered, each one of us who are in this seminar and out there is going to get affected by that. Please understand that. Okay, people are not moving. There are so many businesses shut down. Economy, it's a solution to lockdown. Lesson learned, of course, I agree. But in the sense, like, it has to be, as you said, that you have suggested so many strategies. But one particular thing, water, I feel was,
we have specifically not put the water and its conservative management here, because we were putting it in the next
important factor. Right?
It is.
How can you miss that?
No, ma'am. We are
okay. Fine.
We are putting one positive aspect only.
It can go for volume.
Madam, we have finished the timing.
Yeah.
Question answer. Can we move ahead with the next presentation?
Yes.
05, you are ready?
Yes, sir. Am I audible?
Yes.
Okay. So may I start?
Yes.
Yeah, your time start now.
Okay. Good afternoon, everyone. The topic for my presentation is prevalence of claudication in primary school teachers and observational study. In this study, I had tried to know about the occurrence of claudication in primary school teachers, which is one of the major issue in this population. Firstly, we should know what claudication actually refers to. In general practice, we refer claudication just as pain or discomfort in legs due to prolonged standing. But it's not only pain or discomfort, but also cramping, weakness, tiredness, aching, and burning sensations in the muscles. One of the major misconceptions about claudication is that it only occurs in the muscles of lower limb. But the actual thing is, claudication can also occur in the muscles of other body parts like upper limbs due to its overactivity. Some of the risk factors for occurrence of claudication are smoking, high cholesterol, high blood pressure, obesity, etc. Next slide, please. As I mentioned earlier, the early symptoms of claudications are pain, cramping, weakness, tiredness, aching, burning, heaviness, or a dead weight feeling in the area. Next slide, please. Need for study. As we all know, primary school teachers have a long-standing job and need to engage themselves to stand for a long duration. This may lead to the issue of claudication in this population, and a very few studies have been conducted in regard to this. Therefore, the study was felt to know the prevalence of claudication in primary school teachers. Next slide, please. Aim to find out the prevalence of claudication in primary school teachers, and the objective is to know the prevalence of claudication in primary school teachers. Next slide, please. Review of literature. A study was performed in Saudi Arabia which had concluded that there is a need to spread awareness about varicose veins in that population and sensitize them with the methods to prevent its formation. Another study conducted by Ali El Ali and his colleagues on prevalence of varicose veins among secondary school teachers in acid governorate found that the occurrence of varicose veins in females is more than that of males. Next slide, please. Uh, a study found that long and permanent standing of the teachers is one of the factors for the appearance of varicose veins on the lower limbs. Another predisposing factor for this are observed to be the use of high heels and cross-leg sitting in females. Next slide, please. Hypothesis. Alternate hypothesis is prevalence of claudication in primary school teachers. Null hypothesis. Is there prevalence of claudication in primary school teachers? Next slide. Materials and methodology. An observational study was carried out on 75 primary school teachers. Random sampling was done. Questionnaire was introduced. Demographic data was recorded and asked for occurrence of pain and other symptoms and relieving time and marked by the patient. Inclusion and exclusion criteria. The primary school teachers of both the genders, that is male and female, were included, having age between 27 to 58 years and who were willing to participate in the study. The teachers with cardiovascular conditions, history of trauma, recent history of fever, gastrointestinal tract infections, pregnant women and with other renal conditions were excluded. Outcome measures. The study was conducted to evaluate the symptoms of claudication, occurrence time and relieving time for the symptoms. Procedure followed. Firstly, the permission was taken from IEC, that is Institutional Ethical Committee. Then the consent was taken and the whole procedure was introduced to the primary school teachers. Then the assessment of claudication that included the demographic data, information about the symptoms and relieving time of claudication was recorded with the help of a self-made questionnaire. Data was collected, analyzed and required results were found. Result. At the end of study, it was found that out of 75 teachers, 68 experienced symptoms of claudication on prolonged standing. Discussion. The total sample size for the study was taken to be 75, out of which 68 were found to have symptoms of claudication after working for a long time. Next slide, please. These 68 teachers are more prone to peripheral arterial disease, commonly abbreviated as PAD, in future in comparison to those having no symptoms of claudication. Among these 68 primary school teachers, 41 were found to be female and 27 were male. Next slide. Out of 68 teachers having symptoms of claudication, 49 were observed to have some severe symptoms, whereas mild symptoms were present in remaining 19 primary school teachers. Next slide. Mean time calculated for occurrence of symptoms was approximately 2 hours, and the symptoms were relieved in approximately 35 minutes of rest in most of the population. Next slide. Conclusion. To conclude the study, women doing long-standing jobs are more prone to claudication as compared to men doing the same job. The primary teachers having mild symptoms are also prone to have severe claudication issues in future. Additionally, it was also observed that teachers with more years of experience have shown severe symptoms of claudication than that of those with less years of experience. That's all about my presentation. These are some of the references I have used. Thank you.
Over to you, judges.
I don't have any questions. Sorry.
From the very beginning, you are very clear that there is claudication prevalence is there. Then why have you thought of doing the study? Because all the review of literature which you have given is very clearly stating that there is prevalence of claudication. Second thing, when you have included males and females, you have only taken consideration of their profession. In claudication, smoking is one of the very important factors. So that history taking of that is not included anywhere where you are calculating this. And you have also included claudication time and evaluation when you are doing a prevalence study. How come so? That means from beginning you are very sure that there is prevalence.
No, ma'am. Actually, random sampling was done. No specific number of males or females were decided prior. And talking about smoking and other risk factors.
Because you have only considered one factor, that is prolonged standing, right? But there are
Yes,
various others factors also which are responsible for claudication.
Yes, ma'am.
So you could have taken note of them as well, okay?
Yes, ma'am.
Okay, thank you.
Thank you, ma'am.
Any other questions, ma'am?
No. Go ahead.
Okay. So we will move ahead. 06 is ready.
Yes, sir, I'm ready.
Okay. Your time starts now.
Good afternoon, everyone present here. My topic is, can waist to height ratio predict the body fat? Next slide, please. So I would like to start by saying that obesity is an escalating health issue worldwide, and that is why it is very important to tackle it. So the body mass index, as we all know, correlates totally about the adiposity, but it never addresses the body fat percentage. So the body fat percentage and the body height indexing is a more appropriate measure for indexing the body fat. Okay, so the percentage of body fat is a preferable method for precise determination of the adiposity. And the waist to height ratio assesses the abdominal adiposity and has a greater value in predicting the obesity related cardiovascular health risks as well. Next slide. The aim of my study is to predict the body fat by correlating the waist to height ratio and the skin fold thickness. So my objectives were first to calculate the waist to height ratio, then calculate the body fat percentage using the skin fold thickness measurement, and then to correlate the waist to height ratio to the body fat percentage. Next slide. Next slide. Yeah. So the study design basically was an observational study. The samples were taken by convenience sampling. It was done in a community setting, and the age group was 21 to 60 years old. Next slide, please. I've taken 200 healthy individuals, and the outcome measures were waist to height ratio and skin fold thickness. Next slide. So first the waist to height ratio was calculated. Then the skin fold thickness was calculated according to ACSM guidelines. So there were different sites for both men and women. For women, it was tricep, suprailiac, and abdominal. And for males, it was chest, abdomen, and thigh. After calculating the body density, the body fat percentage was calculated by the Siri equation, that is 495 divided by body density minus 450. When the body fat percentage was calculated, it was correlated with the waist to height ratio by applying the Pearson's correlation. When the Pearson's correlation coefficient was calculated. Next slide. So the correlational coefficient R for males was 0.629 and for females it was 0.545, and this suggests that there was a moderate positive significant correlation between the waist to height ratio and the body fat percentage. Since there was a moderate positive correlation, I went for a regression analysis. After doing the regression analysis, we calculated like a formula was derived for both men and women separately. Next slide. So for men, the body fat percentage formula was 49.732, and then you have to substitute the waist to height ratio in that, minus 3.869. And for women, it was 68.403 waist to height ratio. Again, you have to substitute minus the 0.272. After this, you will be able to calculate the body fat percentage. Next slide. So, as I had previously mentioned, that obesity is an escalating disease, and therefore there are many other gold standards such as DEXA, the body impedance analysis, skin fold caliper measurement. But these all are either expensive, they are unavailable, or they are inconvenient, or they are time consuming to use. And hence, it was very essential to find out an easy method. So waist to height ratio, since it can, it strongly correlates with the body fat percentage, which is distributed abdominally. So now that the research shows that body fat percentage moderately correlates with the waist to height ratio. This formula can be used by at the bedside. Next slide, please. So it is rapidly accessible, clinically acceptable bedside method in order to estimate the body fat percentage. Okay, and using just the waist circumference and the height. So all we need is just a measuring tape in order to calculate the body fat percentage henceforth. So in conclusion, I would like to say that next slide, please. That the waist to height ratio can predict the body fat percentage of an individual, and the formula that was derived can be used as a bedside tool in order to estimate the body fat percentage. Next slide. These are my references. Thank you.
Over to you, Tejas.
No questions from my side.
Come on.
See, body fat percentage you wanted to correlate with the BMI, right? Okay. And whenever your sample size is quite large, and I agree with that. But whenever you want to, you are correlated, and now you are generalizing it that this can be replaced by another. You need to have an intra-rater, inter-rater, reliability, and validity. So the further step would be at establishing that and then generalizing it like that BMI can replace your method of body fat percentage.
Okay, ma'am. Okay, ma'am. Yes, ma'am.
Can we move ahead?
We can go ahead.
Yeah. 08, you are ready?
Thank you.
08. You are there?
Hello, am I
Hello.
audible?
08.
Yes, sir. Hello, am I audible?
Yes. One second. We are sharing your PPT. Yeah, your time starts now.
Good afternoon, everyone. I am presenting the case of physiotherapeutic approach to the treatment of COVID-affected patient. Next slide. The novel coronavirus causing COVID-19 was labeled a pandemic by the director of WHO. Symptoms include coughing, the feeling of fatigue, the production of expectoration, and fever. 20% of patients experience mild to moderate symptoms. The severely affected patient usually require a mechanical ventilator to aid the breathing. Acute care from the initial stage are recommended. For the patient who are hospitalized, access should be especially prescribed and performed to prevent the loss of mass and strength of the muscle fiber. Physiotherapists working on the pulmonary rehabilitation perform the removal of secretion of the affected patient, improve the breathing cycle and the lung ventilation, ultimately aiming at improving the quality of life. I am presenting a case of 16-year-old male. His chief complaint was breathlessness since last 7 days while doing non-strenuous activity. He also complained of generalized body weakness and difficulty in coughing. Next slide. He was detected positive for COVID-19 on 15th June 2020 and admitted on the same day and placed in the ICU. Physiotherapy session were began on the next day. The patient was detected negative on 27th July. He was shifted to general ward on 2nd August, where physiotherapy session were continued. He got discharged from the hospital on 1st September. Next slide. The patient was in ICU for 1.5 months. The physiotherapy treatment began on the first day itself. In the 6th week of being in ICU, portion drainage was done bilaterally on the lungs, especially on the lower lobe. It was done along with humidification. Suctioning was carried out after percussions and vibrations, routinely every 3 to 4 hours. Pulse, sleep, and segmented breathing was taught to the patient. Frequent changes in the position of the body was carried out every 2 hours. Next slide. After the 6th week, the patient was detected COVID negative and showed an ability to breathe independently. By the 7th week, strengthening exercises in the gravity eliminated plane were conducted, which progressed from 5 to 7 repetitions to 8 to 12 repetitions. Coordination exercises include finger to nose, finger to finger, heel to shin, and Frankel's mat exercises were done. Coughing technique were taught in order to expectorate mucus. Gait training and incentive spirometry were also initiated. Next slide. After the 11th week, the patient was discharged and was allowed to go home. Next slide. On observation, the muscle strength fluctuated in the hospital stay. When the patient was first admitted, he had grade 3 out of 5. Then it deteriorated to grade 2 because of prolonged immobilization period. It improved at the time of discharge, a grade 4 out of 5 and 5 out of 5 of the physiotherapy because of physiotherapy session. The joint involved were hip, knee, and ankle joint, as you can see in the table. Next slide. The upper limb shows the same result for joint, shoulder, elbow, and wrist. Next slide. Fatigue assessment scale showed that the score was 34 out of 50 at the time of admitting to the hospital, and the score changed to 46 out of 50 when he was shifted to general ward from the ICU due to being immobilized. At the time of discharge, due to physiotherapy treatment, the score improved to 20 out of 50. Next slide. When evaluating this case, the postural drainage assisted the movement of mucus toward the central direction from the targeted lung unit. This suctioning removed the secretion, hence to improve lung ventilation and oxygenation and the patient's overall ability to breathe. Pursed lip breathing was taught, which increases the use of the diaphragm and reduces the use of the accessory muscles. Overload principle for strengthening was used to improve a muscle performance. Coordination exercises include fine motor and gross motor movement were done to improve balance. Coughing technique and gait training were also found to be effective. Next slide. The case concluded the importance of physiotherapy from the first day of being detected COVID positive up to the last day of rehabilitation. Physiotherapy is important in the ICU, in the ward, and after the discharge to effectively carry out activity of daily living. Next slide. These are the references. Thank you.
Over to you, judges.
I don't have any questions.
I don't have any question. One suggestion was that she could have also included an endurance training protocol to her management part. Thank you.
Yes. Yes, ma'am. Thank you, ma'am.
So we had finished with the cardio presentation for senior and junior category. I would like to thank our both the judges who had taken the time from their busy schedule and give the justified decision to the all the presentations. I request both the judges to kindly send the mark sheet on our Rehab-e-con email so that we can declare the result in the valedictory and also with a signature. And also I request both the judges to kindly share their views on this platform.
Thank you so much, Varsha ma'am and the Rehab-e-con team for organizing such a beautiful event. It was yesterday's session was also very nice. Arunmaya sir's lecture was awesome. And today also all the things were very well organized. And I am really blessed to attend the session with Shilpa Param ma'am. She is a mentor for all the cardio people. Thank you so much for giving this opportunity.
Lot of learning experience from all your young people, you know. And I have the same view as Gauri. We had, in spite of like we have been battered by COVID like anything and events like this. And heartiest congratulations to Bakirbai Bansare College for taking this initiative so that mundane COVID thing would be over and the admission tension would be over. And we really had two enjoyable Saturdays and Sundays. Like, you know, it was very fulfilling session actually. And congratulations to the organizer, especially Varsha Kulkarni, Virendra, and all the team members of LSPS College of Physiotherapy. And all the best for future endeavors. Thank you.
Thank you, ma'am. Now I would like to request Dr. Pallavi Mahajan to give the vote of thanks.
Once again, I would like to express my sincere gratitude to our both the judges for taking out time and being a part of our Rehab-e-con, the national conference. I would request Mr. Omkar and Mr. Piyush to please just give a token of gratitude to Dr. Shilpa Param ma'am and Dr. Gauri Afle ma'am. Mr. Omkar, can you please show the memento?
Yeah, thank you so much, guys. आपने इतना अच्छा presentations and वो किया सब किया. Thank you so much.
Can you show the memento, please?
एक second.
Sorry for the delay.
No, it's absolutely okay.
Little bit of technical issues. You both can either WhatsApp me or email on the Rehab-e-con.
It's easy to do it on WhatsApp, Pallavi. I'll send it to you.
Okay, ma'am.
Yeah, immediately after we close down.
Okay. Ma'am, due to some technical issues, we will not be able to show the memento.
Thank you.
Ma'am, one more information we wanted to give. The valedictory function will be soon held after all the presentations are done. And the link for the valedictory function is the same as yesterday.
Okay. Thank you.
And all the participants, the link for the valedictory function is the same for yesterday. So we will drop a message to everyone regarding the timing of the valedictory function. Thank you. Thank you so much, everyone, to be a part of this conference. Thank you, ma'am. Thank you, Dr. Gauri Afle, ma'am. Thank you, Dr. Shilpa
Thank you.
Parakh,
Thank you, Pallavi ma'am.
Thank you. Have a nice day.